live.
Good morning. Recognizing a quorum of commissioners, I call the January 15th, 2026 meeting of the Cannabis Control Commission to order. This meeting is being held hybrid pursuant to Chapter 2 of the Acts of 2025 and being recorded. Commissioners Benedon, Stebbins, Roy, and myself participating in today's meeting. All votes taken today will be by roll call. We have a full agenda today that I will generally summarize. We will start with opening comments from commissioners, followed by a vote on meeting minutes. Then the executive director will present executive director and commission staff report before we proceed to staff license recommendations. There are 2 change of ownership recommendations, 69 license renewal recommendations, 6 provisional license recommendations, 4 final license recommendations, and 1 responsible vendor training renewal. There are 7 items in the commission discussion and vote section today. The fiscal 2027 budget discussion and discussion of receivership process, notice of deficiency and preliminary referrals, delegation of powers to approve licensees, de-anonymization, I'm glad I said that right, of raw testing data without waivers, an executive session minutes release process, and then an update on motion to intervene in Bill RICA. I will ask that commissioners wishing to comment or ask questions during any part of the meeting will raise their hand to be recognized. If needed, the commission may enter executive session. With those initial comments, I will turn things over to commissioners, and I will start with Commissioner Benedon for any comments from today, yesterday.
I do not have anything to add since yesterday.
You were so good yesterday. There's nothing. All right, sounds good. Commissioner Roy.
Good morning, everyone, and thank you, Madam Chair. Super brief. I just want to thank my colleagues and for a robust conversation yesterday around Secret Shopper, and I want to thank Attorney Bruno for all of her work, and as well as our exclusivity discussion, which was also highly informative. And I'm just so happy about Secret Shopper. I've been focused on that since January of 2023. And yesterday, I think, was a huge leap forward to fully execute the potential of that program. So again, thank you to Attorney Bruno and my colleagues for that discussion, and also around exclusivity. I just want to thank staff for all the work they've done to get us to where we needed to be yesterday. So just want to make a few acknowledgements and thank everybody. Thank you.
Thank you. Commissioner Stebbins.
Thank you, Chair. Just some quick updates. The social consumption RDT working group is picking up our work. We've sent out invitations to the outside stakeholders who have expressed interest in supporting our work. On Friday, the internal group is joining me for a call with folks taking the lead on training in New Jersey. And then later that day, our colleague Armenianos and I will connect and begin laying out next steps and some potential anticipated meeting times. Also, quick shout out and thanks to our licensing INE and IT team. As we've all seen when reviewing our license renewals, there is some new additional space for document upload, hopefully to make our review as well as our licensees' ability to share updates on their progress toward their positive impact plans and diversity plans, hopefully a little more readable and hopefully a little more efficient on their end. But that's it.
Great, thank you. And again, I want to thank my colleagues, and again, I want to thank the staff, the work making sure that we got both Secret Shopper, but also getting the exclusivity work. I want to thank all the people who did work on that exclusivity regulation initial draft, and hope we can get a little business done today. So with that, I will start with the next item on the agenda is the approval of 7 sets of minutes from October 23rd, 2025, October 29th, 2025, November 6th, 2025, November 7th, 2025, November 18th, 2025, December 4th, 2025, and December 11th, 2025. Congratulations to our new, whoa, that was, yeah, we,
I want to give all the credit to the staff who put these together. I know the commission had a lot of meetings in the late fall, more frequent than the regular cadence. And so there's a lot of work to both prepare for the meetings and then, of course, do the minutes. And so I'm grateful for the staff who when I came in and said, we have to get up to date on this. They did. They really did.
No, as I said, we are very happy. Yeah. And we're very happy that Commissioner Stebbins offered you up to take this job on. So anyway, so we'll begin I'll entertain a motion to approve the October 23, 2025 meeting minutes. Commissioner Benedon, will you make that motion?
So moved.
Do I hear a second? Commissioner Roy?
Second.
Having been moved and seconded, I will take a call of the roll. Commissioner Benedon? Commissioner Roy?
Aye.
Commissioner Stebbins?
Aye.
Chair votes aye. It passes unanimously. Commissioner Benedon, do I hear a motion to approve the October 29th, 2025 meeting minutes?
So moved.
Do I hear a second? Commissioner Roy?
Second.
Having been moved and seconded, I'll take a call of the roll. Commissioner Benedon?
Aye.
Commissioner Roy?
Aye.
Commissioner Stebbins?
Aye.
Chair votes aye. It passes unanimously. Motion to approve November 6th, 2025 meeting minutes. Commissioner Benedon, do I hear a motion?
So moved.
Commissioner Roy, will you second that?
Second.
Having been moved and seconded, I will take a call of the roll. Commissioner Benedon? Commissioner Roy?
Aye.
Commissioner Stebbins?
Aye.
Passes unanimously. Chair votes aye. Sorry, did I say that? I can't remember. Anyway, once again, a motion to approve the November 7th, 2025 meeting minutes. Do I hear a motion, Commissioner Benedon?
So moved.
Do I hear a second, Commissioner Roy?
Second.
Having been moved and seconded, I'll call the roll. Commissioner Benedon? Commissioner Roy?
Aye.
Commissioner Stebbins?
Aye.
Chair votes aye, passes unanimously. Motion to approve the November 18th, 2025 meeting minutes. Commissioner Benedon? Commissioner Roy?
Second.
I hear, having been moved and seconded, I'll call the roll. Commissioner Benedon?
Aye.
Commissioner Roy?
Aye.
Commissioner Stebbins?
Aye.
Having been passed unanimously. Chair votes aye, it passes unanimously. Again, Commissioner Benedon, do I hear a motion to approve the December 4th, 2025 meeting minutes?
So moved.
Commissioner Roy, do I hear a second?
Second.
Having been moved and seconded, I will call the roll. Commissioner Benedon? Commissioner Roy?
Aye.
Commissioner Stebbins?
Aye.
Chair votes aye, it passes unanimously. Once again, do I hear a motion to approve the December 11th, 2025 meeting minutes?
So moved.
Do I hear a second?
Second.
Having been moved and seconded, I'll take a call the roll. Commissioner Benedon? Commissioner Roy?
Aye.
Commissioner Stebbins?
Aye.
Chair votes aye, it passes unanimously. Oops. Here, sorry. Okay. All right, we are going to the Executive Director and Commission Staff Report. Executive Director Travis Hearn, take it away.
Thank you, Madam Chair. I'm going to go through one slide here, which is very dense, obviously, so happy to talk through anything and clarify. We also will have a quick update from the Director of Digital and Creative Services, and then we'll do the standard licensing update, although I have a couple notes on future licensing updates here in work that is being done. So again, this is a very dense slide. I'll try to go through it all. Obviously, if there's anything unclear, please stop me. Otherwise, I can certainly take questions at the end. So this slide summarizes a lot of great work that has transitioned from the 2025 goals to 2026 implementation. First is the final social consumption regulations being approved on December 11th and approved by the Secretary on January 2nd. Those official regs are on the website as of this week. We did have a number of requests for them, which is now allowing town councils for all municipalities to begin to do their work developing local bylaws and ordinances. And as we obviously are doing our work as well, getting the license application and processes ready. And I'll note further collaboration coming momentarily between the agency and a variety of external stakeholders, including municipalities. Yesterday's approval of delivery exclusivity and secret shopper regs will start the promulgation process to be filed this Friday. So please note, obviously, that the legal team is working very hard today to get that accomplished. And I would like to ask the chair if we could put a final report of the 2025 goals on the January 27th agenda, because I think that will wrap not just those two items, but a number of items as well into the equation. And obviously, I will be looking to discuss just at a minimum some prioritization questions for the board as we transition from 25 to 26 and start new stages of development of these critical projects. Other deliverables sort of outside of those goals that obviously I'd like to update and go in depth on the 27th if we have the opportunity to do so are two recent requests for information, which I reference here. I did provide kind of a written summary of where we are in the process of compiling that. The external referrals and the NODs by violation and license type have been interesting projects. And so again, projections for completion with an explanation of next steps to complete these information requests. For example, on the NODs, each NOD can have up to 25 violations. It may include multiple licensees because it may be an NOD for vertically integrated. So to break it down in the way that I believe is the intent to create educational materials, we are proceeding with that. And as I mentioned here, with estimated dates, I've phased them based on when those requests came in. Other deliverables for future agendas, obviously through the chair, that are also in the works, just as a way of an update, would be the inclusion of tier relegation data in the monthly licensing updates for February 2026. These changes went into effect in January. And then also the review of the testing protocol recommendations, which are currently in review by council, specifically Attorney Bruno, who is also completing the regulatory package I mentioned today for Friday. A timeline estimate I'll be providing today. Obviously happy to go through that. And I know that the intent as well is to assure that we get those protocols out for informal comment period in time for the commissioners to have access to feedback from industry and others before you review that in a public meeting. And then Attorney Bruno has also put together kind of the back end of anything that may be regulatory or other votes that may be required and where those dates are coming. So I'll provide that updated timeline and we can go through that. And then as on the bottom here, just for other engagements, obviously, I believe it was mentioned by at least one commissioner in opening remarks, the social consumption working groups have been established. And we have added project management as a through line for those 4 working groups to ensure efficiency of tracking tasks. The 3 groups that have external consulting groups should be able to kick off with those teams this month. Those are public awareness, local advisory, and RVT. It's important to note also for the implementation working group specifically, there are a number of items, even though we consider it the social consumption package, that are in addition to social consumption. I believe yesterday the chair noted the inclusion of inversion and diversion in our definitions as well. The industry is very interested in the outcome of some badging improvements that were made for efficiency, a bit of a precursor to red tape removal. And so obviously those will also have tasks assigned and updates for the board as we get towards implementation. A number of those items, as we've discussed sort of ad nauseum since I started in March of last year, has been the challenge in a lot of these is making sure that we get them done and accomplished through JD software in the licensing platform. And so a lot of that is really kind of when people ask, what is the work that's going into getting those things live? Most of it is IT related, working with our third-party groups. I note also here that the red tape removal working group was established and discussed in December, and that first meeting is scheduled for next week, which is the 21st of January. So a lot of work going into that with commissioners and the government affairs. I believe it is in person, but I believe just obviously as we generally do, you'll always find somebody, especially in flu season, that I think we would try to make it available remotely. Yeah. And by using this room, we would use the hybrid. Open data, and obviously just to kind of reiterate for anybody who's new to that process, that one of the main goals here, obviously a lot of regulatory work done by this board with social consumption, including badging and inversion. Now getting into what we did yesterday with delivery exclusivity and secret shopper, and then this would really be preparing the board to prioritize what you would like to see there beyond there to cut down on red tape and make improvements for the agency and the industry. Open data, I won't get too far into because I know it's later on the agenda today, but improvements have been planned for March 2026 by the data team within IT, with COAs going on the metric product catalog, which was approved on December 11th. And that, again, estimate would be for March 26th, as we had discussed. The aggregate testing data is being discussed later today, but as well, I think the only question with that the board will discuss is related to either anonymization or de-anonymization, but ultimately the data team is also prepping to have that cadence on a quarterly basis ready to go in March of 26. And finally on the list, obviously, yesterday was a very big step in that process, but you will have quite a few meetings. I think we noted the meetings that will happen on Secret Shopper to make sure that you all feel comfortable with that. there's quite a bit of work to do, obviously, before the final process, but yesterday was obviously a major milestone. So again, my hope would be in delivering the final report on the 2025 goals at next meeting, if the chair is amenable and we can fit it in, that we could then also discuss prioritization as we switch these goals from some of which have now moved from a, aspirational to implementation or operationalizing, that we are able to have that discussion, because obviously this is a lot of material and it's all very good, but it is something that we have to balance. So that is the update. Obviously, it probably isn't even comprehensive to some of the other things we've discussed, but I just wanted to put all those things in perspective and intend to follow up there. So I will take a break if there's any questions. Otherwise, we can move on for the other items.
I think we can keep going.
Okay.
Very, and again, looking at the tremendous progress that's been made in the sort of final quarter of the year. Again, congratulations to the executive director, my fellow commissioners, and the staff that have made so much progress in so little time. But also, we have a lot of work to do because we've gotten so much done. It means that we have so much more work to get done in both with the regulations that have the April deadline, but also other pressing issues that we're going to address. So I know that we will be asking a lot of our staff, and appreciate the work that's been done so far. Thank you.
Thank you, Madam Chair. If we go to the next slide, I believe right before licensing, I have one update. And I'll ask if Emery wants to come up, just if there are any questions. Just a quick update on the Where to Buy website, and a note on it launching. If there are no questions, that's fine, but I just wanted to give an opportunity.
I can acknowledge, I think I talked about this yesterday, and I had not seen the book, and I'm so thrilled that you've done this. So thank you. Well, you're surprising. Yeah, no, I know. Whew, that was that, but seriously, I had no idea you were working on this. So thank you. This is great. Yeah, this is great.
Yes, it's been a lot of work between digital and creative and IT for the last few months. As you know, we don't have permanent web developer on staff. So we try to collaborate and get as much as we possibly can between the two departments.
But I hope you know that this was, I don't know if you were able to watch the meeting yesterday, but this is such an important component of looking at success of social equity applicants. So again, I did not know this was in the works. So again, thanks to the staff who did this work on this. Thank you.
Thank you.
Yeah, but again, I'll turn it over to you now.
Director with the timestamp of, I think she just mentioned it.
I thought it was brilliant, but obviously it wasn't. So anyway, thank you.
We hear the challenges that the delivery operators and couriers face in the advertising and trying to get their businesses out in front of people. So we've been trying to figure out a solution to help them for quite a bit of time at this point. So to kind of start at the beginning of the slide, we had the Find a Retailer webpage on our website since we launched it back in 2021. We have since added delivery operators and couriers, and we launched a new functionality that gives you the ability to be able to sort by delivery as well as medical, adult use, and co-located. So you'll now see that delivery icon that appears within the line at the top. If you click on that, you'll see all of them listed. You can search within your zip code as well to see any that are around you. The consumer will need to take the extra step to go to their webpage or contact them by phone to see if they actually delivered to their zip code, because they all kind of define their own radius, such as sort of a pizza shop says.
And one question, just making sure that it's almost like suggestion only, because obviously we don't know if someone's going to still be open. So, I don't know if there's any language that, you are directing them to go there and to do that to make sure it still exists.
Yeah. Yes, I actually went through all of them yesterday in anticipation of this presentation to make sure they all still had live websites that were accessible. And there were two businesses that I think they have their commence ops, but they're not currently in operation. So I made sure that they weren't listed.
Thank you.
Yes.
It's great.
And we also get the information from licensing when people commence operations, and then my digital media specialist goes in and adds them to the spreadsheet. So yes, we launched the new Where to Buy webpage. Technically, we changed the content and changed the name on Monday in anticipation of the delivery exclusivity discussion that we were having this week. So as you mentioned, you had a question yesterday concerning the presentation about the report of the challenges of advertising. So I am happy to report that we have fulfilled your question from yesterday.
Thank you. you. This is great. And this is one of the things, I mentioned yesterday, working, because we don't have a public education budget right now. One of the things, and I'll be speaking carefully, not in in open meeting, but also just working with our comms team, working with Director Williams, to make sure that we do a little bit of outreach to make sure that we're providing, education about how to access this, which I think will help some of these social equity businesses, but also promoting our equity employment. I'm getting the name wrong. What's the
Equity Works.
Equity Works. Yeah, Equity Works. So I hope to engage all my fellow commissioners and the executive director doing a little earned media to get some of the word out. Commissioner Roy.
Thank you, Chair. Thank you, Director Burns. This is awesome and timely, right, with yesterday's vote. My question is, and this might be an IT question, I'm not sure. So we have this, and then we have our new product catalog in March. And that will show, like, if you want a Betty's, Eddie's, where to buy. Is there room how do they work synergistically? Is it possible for them to interface or integrate? Like, so if I look up Kim Roy's Cannabis and I want Betty's, Eddie's, is there a way so they can work together? And I see Paul coming up.
I certainly will.
Thank you, Chair. So at this point, the Metric catalog is separate. Product catalog is run by Metric, is separate from our website. Certainly, there's links to the Metric product catalog through our website.
Yeah.
But the ability to directly integrate those right now is not something that's going to be easily accomplished, but it's certainly something we can talk about and look into. I'm not, because I'm trying to, I think I understand what the picture is of what you're asking for. I know we've historically tried the product catalog was designed in such a way really not to be an advertising mechanism. It was really an enforcement and education tool.
I thought that was just like this unintended benefit, like that, even though it's not supposed to be for marketing, advertising, but a benefit to our retailers to know where to buy. I'm just wondering if you could put a link to the product. How's a link to the product catalog in here? Is that appropriate?
We could certainly, I could work with Anne Marie to get that done, and I'll certainly discuss with Metric potentially to link back to this page in some way. That's some things we could at least, again, look into.
Okay.
To at least cross-link with each other a little bit more easily. That's certainly something we can at least evaluate.
Yeah, I mean, I know folks that have to call around to different, say, or do you have Levia in stock, or do you have?
If I can, one of the issues is sometimes the retailers run out of product. So you have to be, you know what I mean? Sometimes they still do have to call because you go in and they've had something before and they don't always have it in stock. I mean, Stop and Shop on a Monday, I mean, but I'm just saying, any of those stores, you don't necessarily know what's going to be there. So I think it's something I think that having the link to the COAs is good, but I just want to give some thought.
Yeah, we can look into it.
Yeah.
It's just a thought that, how could they work synergistically together?
Yeah. No, that's
Yeah, I mean, we certainly evaluate. I mean, at least a link, if we're from where it's being reported from the product catalog, at least a link in some regards to the actual retailer. And now you get into the question of whether it's to their website or to our find a retailer,
I know.
2 or 3 clicks, but it's certainly something we can
Okay.
gotta look into. Yep.
We might need to do a little bit of legwork, like if they see in the product catalog that, you have Betty's, Eddie's at XYZ store, then they can look up the store in the where to buy page. But as Chair O'Brien said, they.
Doesn't guarantee it's an inventory.
Yeah, you'll need to check their menu to see if it's available.
Yeah. That's
Pretty good. Thank you. Right. Awesome. Thank you.
One note, and this is something I can follow up with you separately on, but in looking at the website, I pulled it up on my screen. I wonder if we can do more to distinguish which of those red dots are delivery only. Because one thing I heard from some of the delivery operators is that people sometimes walk in not realizing that they're actually just like a delivery office, not retail. And I'm looking at this and looking at how it appears, and I wonder if we might be the ones causing that confusion.
So we actually, for the delivery businesses that don't also have a retail operation, which I think there's only one, which Major Bloom has both, but all of the other delivery businesses were suppressing their brick and mortar address here, trying to dissuade them from just showing up and trying to purchase at their warehousing facility. But I certainly will speak with IT about potentially changing the color of the bins for the delivery business.
Yeah, something like that, because it shows up here, and from what I'm looking at, I can't tell how it appears differently than the other ones. Like it has the address of their office.
Yeah.
But it shows up here.
We'll take
So that might be something we could do.
Commissioner Wright?
So in the website, when I put in the search where to buy, like it comes up multiple areas. So where to buy, it says, if you put where to buy in the search on top, it sends you to know the laws. It sends you to patients and caregivers and then register as a new patient. And fourth, it comes up the true where to buy. Okay, thanks.
It may still be caching too in the Google programmable search since we just.
Just search engine optimization type of.
Yeah, since we just changed the name on Monday, but we'll definitely. take a look at that for you.
Better if you could push it to the top somehow.
Thank you.
And yeah, so just to kind of summarize as well, I think the chair mentioned it earlier, the comms team will work with digital as always, make sure that it gets out there. And I think to the chair's point, well, we can do some work as well to make sure that this asset is used. So thank you for that. And that is all I have before turning it over to licensing under the ED report.
Thank you very much. Thank you. And again, Director Manager. Okay. So is Director Cole or Manager Suko Devote going to be, who's going to be healing? You are.
I'm going to be first.
Okay. All right.
Yes.
I-
All right. Hello, everyone.
And this is, I know we use titles here, but it's sometimes I get a little confused.
I hear you. All right. As you can see, we have 10 applications awaiting first review, 13 applications awaiting supplemental review, and you can see the number of certified active patients. It's around 77,000. Here, I will highlight that the number of commenced operations since last month have gone up by 3, and we are at a total 8.5% increase since the same time last year.
Thank you.
Here is the same, our pizza chart that we say every month. And again, the main highlight is the commenced operations, the fact that we have that we have allowed another 3. Yeah, it's okay. I have it down there. Thank you. Thank you. I don't know. It's completely like dry. Thank you so much. Appreciate it.
We go back.
Can we go back where?
Yeah, back. I didn't get a chance to really.
Oh, back to the
Yes.
other slide, the previous slide or this slide?
This slide.
Yeah, so what I'm highlighting here is that we have added another 3 commenced operations since last month, so similar to the previous slide.
Okay, and then I just want to highlight through the chair.
Please, thank you. Yes.
Yes, so we have 11 active ITLs.
Yes.
Okay.
Does active? Yes, they're all active. Okay. Go ahead. Thank you, Director Kuba.
Next slide, please. So here I will highlight the total possible canopy has increased by 10,000 square feet since last month, and specifically 5,000 for commenced operations. So I believe we added one of the commenced ops that we added since last month was cultivator.
Thank you.
Chair.
Rudd?
Actually, go ahead. It's there. Next slide.
It's in the next slide. All right, next slide, please. Here again, not much has changed, and we can see all the numbers that you had previously requested in terms of expired indoor, outdoor, and the total maximum canopy.
Commissioner Wright.
Okay, Director Koval. So is that new, the total maximum, total minimum? Is that a new?
A new component of the slide, you
feature?
mean?
Yeah.
I believe it was last month.
last month.
Right, so that's, okay, so it's
Oh.
fairly new.
Yes.
Because someone had brought up to my attention when we say we have over 3 million square feet of canopy, it's a range, right? And we just kind of round it
Definitely.
up. So this kind of
Definitely.
breaks that down, but it breaks it down for,
I mean, this also,
like, that's why I looked at it last night and I was confused.
yeah, it could be, it's a lot of information at once. So the top part, obviously just shows the active ones, and then the bottom part is showing the indoor expired versus outdoor. So the total maximum canopy for indoor versus outdoor.
Expired.
Yes,
Is-
by license phase. So, it means we have, for example, 5 total expired that are in final licensure phase. And the total maximum canopy is 90,000 and 55,000 respectively.
Commissioner Wright?
Not to give you more work,
Hmm.
but is there a way to do the minimum canopy for the active ones? See how you have it for the expired maximum, minimum? Is there a way to do maximum and minimum up top? For the
We-
active ones?
I would have to look into it and talk to data as well. I don't see why not.
Okay,
Yeah, we can,
all right, thank you.
yeah, no
Can you
problem.
just explain what that?
So when you have
clarifies?
tiers are in a
Yeah,
range,
right,
0 to 5,000.
right.
So what we were doing was we were automatically going to the high end of the range, rounding up. So it might paint slightly inflated picture of the true canopy. So this way we could have, okay, if everybody was at the bottom of their range, that's the minimum. And if everybody was at the top of the range, that's the maximum. And the truth probably is somewhere in the middle,
Right,
you know what I mean?
right.
But at least it gives the range.
Okay, gotcha.
Okay.
Thank you. Thanks for clarifying that.
All right, we can go on to the next slide. Here, I would like to highlight that our model HCA's have gone up by roughly 20, and the compliant HCA's have gone up as well. And in terms of towns with at least one compliant HCA, we have gone from 166 to 168. So we have added another 2 towns who have at least one compliant HCA. Next slide. Here, as you can see, our world for extensions, and we have received again, we keep being steady of receiving at about 100 extension requests a month. So we've added roughly another 100 since the previous reporting month. And here, as you can see, all the municipalities with extension requests, we are up at 176.
Any questions? Thank you.
I think that's all for me.
Good. Thank you. So you're going to be Manager Defoe, you're going to be handling the next part? Yes. So we'll be going on to staff recommendations on change of ownership. Going to LDE Holdings.
Right, the licensee here is LDE Holdings LLC. They are seeking a change of ownership and control of 3 adult use licenses and are requesting to add 1 individual and 1 entity. Commission staff has reviewed the application for compliance with applicable laws and regulations and are presenting it for commission review and vote.
Thank you. Any questions or comments from my fellow commissioners? Hearing none, Commissioner Stebbins, I will entertain a motion to approve the change of ownership for LDE Holdings.
So moved.
Commissioner Roy, do I hear a second?
Second.
Having been moved and seconded, I will call the roll. Commissioner Benedon, Commissioner Roy, Commissioner Stebbins.
Aye.
Chair votes aye. It passes unanimously. Going on to Solar Retail Norton LLC.
The licensee here is Solar Retail Norton LLC. They are seeking a change of ownership and control of 1 adult use license and are requesting to add 1 entity. Commission staff has reviewed the application for compliance with applicable laws and regulations and are presenting it for commission's review and vote.
Thank you. Are there any questions or comments from commissioners? Hearing none. Commissioner Benedon, do I hear, I'll entertain a motion to approve the recommendation of change of ownership for Solar Retail Norton.
So moved.
Commissioner Roy, do I hear a second?
Second.
Having been moved and seconded, I'll call the roll. Commissioner Benedon, Commissioner Roy,
Aye.
Commissioner Stebbins,
Aye.
having been moved and seconded, and the chair votes aye. Wait a minute. Commissioner Roy, do you have a question? Sorry.
Oh, I don't want to interrupt your.
No, go ahead. No, I was about to call the roll and I
You did it.
did. Oh, okay, so we're done. So Chair votes aye, it passes unanimously. Sorry, I thought you were questioning.
No.
Sorry about that.
So I just want to put a pin in change of ownerships, because when we have our receivership court appointee discussion later, and I have brought this up a few times about we have prioritization in the queue for changes of ownership if it's a distressed transaction, because we're trying to save jobs here, bud tenders, and time is of the essence sometimes in these instances. So I don't know if this is something we would have to direct staff to do. We have 24 receiverships right now in Massachusetts, and it seems like there's an upward tick that is trending in that direction. So I don't know if the executive director has any thoughts, what my colleagues think, but I just feel, the goal is to, obviously try to save the business, but also save jobs for people that work there. And sometimes these deals are fragile and, time could work against it. So I don't know, Mr. Executive Director, if you have any thoughts to the chair or?
Please, thank you.
Thank you, Madam Chair. I think if we want to, as you mentioned before, put a pin in it and come back to it under the receivership discussion later on the agenda, I think we can discuss that in that context.
Okay.
Thank you.
Okay. Thank you. And then I'm moving on to staff recommendations on renewal of licenses, which will be voted on as a group. And I don't think there are any recusals here or anything. Director, Manager Defoe, sorry.
There's 63 adult use and 6 MTC renewal recommendations for the commission's consideration. Commission staff has reviewed the applications for compliance with applicable laws and regulations and are presenting it for commission's review and vote.
Thank you. Commissioner Benedict?
I just had some questions really to help me understand the process and the timing for some of the renewals. So looking closely at the list, and we do have a very long list for renewals today. I saw that there were a couple of licenses that are scheduled to expire today. Several more that have an expiration date within the next week or so. And I know I've heard other commissioners sometimes hear from licensees who get really nervous when we're cutting it so close. And I'm wondering if you could explain for my benefit what some of the factors are that impact the timing. Some of them are being renewed 2 months in advance, which is great.
Right. Yeah.
You could also talk about what the notification is that you do provide.
Right.
Yeah, how did they know?
Definitely. So I want to flag really 99% of the time that this delay is caused is because people do not submit in time. So they will submit.
Can you talk about the time frame, because I think it'd be important to understand.
Yes. So
We talked about this before. There are communications that go out.
Right,
Sometimes they
for sure.
don't get responded to.
So we have, first of all, the regulatory requirement is they should be submitting a renewal application 90 days prior to expiration. Mass CIP sends them on average about 12 automated reminders. They go out bi-monthly, and then I believe the last week they start going out maybe even more often than that. IT could help out with that, but they definitely get a lot of notice. But what happens is a lot of people, for whatever reason, they submit 2 weeks, for example, remember we have to have our public meeting information in time for the public meeting. We can't put anybody on the agenda today. So it's literally, it puts the renewal team in a spot where we try to get everybody as well as, as we can on the agenda. But if they don't give us enough time, we cannot do it. The other thing is too, let's say you submit let's say for the February 12th public meeting, let's say somebody submits today. Licensing staff will review it today, but it's not guaranteed that that application is compliant. So we will kick it back with a request for information saying, please, can you, give us more information about X, Y, and Z. Sometimes we don't get a response, or it'll take till, the very last minute. So I do, thank you for bringing this up. I do want to take this as an opportunity to remind everyone, please submit your applications, your renewal applications in time, so we can have enough time to go back and forth if anything is needed, so we can, get you on the public meeting before you expire.
Please, Commissioner Benjamin.
And is there, and I know so much depends on the volume, it seems like,
Mhm.
this month we have more than last month, so obviously that impacts your team. But is there communication to licensees? For example, we need to have the fully completed application with any issues fixed, let's say 30 days before a public meeting, or like, how do they know that if they submit it 2 weeks beforehand, that isn't enough time? It makes sense to me that that may not be enough time, but how do they?
So we've put out a bulletin. I don't recall the exact date, just reminding them of the regulatory requirement that they should be submitting everything 90 days prior. So there is a bulletin out. It's been discussed in previous public meetings as well, this time frame. So, but I could check, see when the bulletin went out.
Thank you. And we've actually had a couple, I mean, some of these were provisional licensees who were trying to get in under the gun, and sometimes they waited a little bit, but we have actually, and I especially thank both Manager Defoe, because we've actually had a couple that have come in very late. They've been social equity, and these are obviously provisional applications. So, and we bent over backwards, and in 2 instances added extra meetings so we could accommodate that. But we can't do that every, at every meeting. So it really is on the licensees to be able to do that, and so that's why I wanted to have her understand the timing, because they really do give a lot of notification.
A lot, yes, definitely.
Commissioner Roy?
Director Coble, I have 3 questions. Does the first reminder go out at 120 days? Like what?
Yes, so it goes before before
That's
the
what I
90
thought.
days. Yeah, they have.
My second question is, you said it goes out through Mass CIP.
Yes.
Is there a way to put a big bold banner across, so every time they go on a Mass CIP, everybody would see this?
So we have actually explored that with IT, and I don't know if Paul is still here. So we have explored that with IT and our third-party vendor. The issue is the licensees don't really use Mass CIP on a daily basis. They use Metric. Metric is the platform.
Is there a way to put it in metric?
I mean, that's something that we could explore. Again, I'll defer to, yeah, and I'll circle back with
That's
Paul
okay.
about this, because one point I've also requested if there's perhaps automated phone calls or texts or
That would be
whatnot.
Amazing, actually, people.
But I don't think we have the infrastructure right now. My understanding is to do that. But again, like trying any venue possible, it would be great.
A standing headline if they're, you know what I mean?
If they're in metric every day, then
Right.
if there was a banner across the top.
Yeah, I'll definitely bring that up to Paul, because I think any venue we can try to remind
I
them.
also think the question is, who does the email go to, right? Because there could be change of staff or something. And again, if they're not updating, and Paul is here, so, but if who does the email go to? Is it more than one person? or-
It should go to the principal that is signed up to the account, which is usually an owner, or it's not just any staff. Typically it's, and Paul, I see
Okay,
Paul there.
One more question.
Okay, you-
Paul.
please, yeah, thank you, Commissioner Roy.
No, let Paul. Me to restate it?
Yes, please.
Okay, my question was, because Commissioner Benedon said, sometimes they come tight up against, like, some of them are ready to expire today, some are expiring in a couple of days. And we do a great job, 12, a dozen reminders in Mass CIP, starting at 120 days out. But Director Coble was like, well, they're not in Mass CIP every day, they're in Metric every day. And is there a way that Metric would allow us to put a banner about 90 days must be submitted, so it hits them?
So right now, there's not an automatic way to do that. We did inquire about that because we understood exactly that issue, that they're in and out of Metric multiple times a day, and not necessarily Mass CIP.
Right.
So the challenge is there's not an automated way to do that today within Metric, because it's not really there.
A standing
So-
banner, standing, so every day they see it, like,
But you're talking about by licensee or for just all commission licensees?
yes.
We certainly put a static banner that would appear for all licensees, but again, it would be all licensees and all users, which, we talk about banner fatigue, however,
Oh, so they
setting
don't see it
into, they
anymore,
start
they
at
see
some
it every
point.
day, they don't see it anymore.
And we also use that for other messaging as well, but it's
Okay.
certainly something we can do
Thoughts?
intermittently. Again, we've expanded the emails, as Olivia mentioned, from just the primary contacts to anybody we have.
Yeah.
Which, it helped a little, but not, I don't think it's made the impact that, we hope.
See, I worked for a company once that we were looking at, because if someone's having a heart attack, it's like, sometimes you hear all these things beeping, and it was actually a way to make sure that when someone is really, really dying, that you were paying attention, because so many things are going off in an emergency setting. So I totally get what you're saying. Commissioner Roy?
So, and we asked Director Koval, so like CVS, right? My prescription's ready. That's so, and then, it's going back on the shelf by Tuesday if you don't come and get it. So it's like, that's the best way to get people, but we don't have the infrastructure for that, right? To text them like reminder, renewal.
We actually looked at, trying to do postal mail as well, just to make sure the ownerships get to it. I mean, we can update the email templates as they get closer to the expiration to add some maybe stronger language to that effect. I think it's pretty strong.
Well, we can't have phones, right? I think she's referring to like, we can get a text.
Yeah, that's like.
Yeah, right now we don't have the SMS infrastructure. It's certainly stuff that, is going into future procurement concepts is.
That's the best way to reach people.
Nowadays, yeah.
I agree. That's why I was really hoping we could do something by phone. Because I agree, CVS is where my head went.
Yeah.
I'm getting long pieces of paper, and I don't think that's good, but
No,
we're
safe. Bucks.
But one of the questions I was, wondering, because if someone is gone, right, and maybe that's going, and maybe it's not bouncing back, but, maybe there could be an alternate contact that, not alternate, but a duplicate, another person that maybe there's more than one person that's receiving the email, that might be also making sure that, because it's keeping the response, because see, the problem is we're communicating with them, but they're not paying attention. And so, maybe there's another person within the organization.
Right.
Their duplicate emails that go to two different people.
And I do want to say we did add, now it's going to two places.
It's going to the primary, the business address, the point of contact address, and then also all the agent addresses.
Okay.
Oh, that's good.
Multiple, because it also goes to the agents.
Right.
So
we understand a lot of times the owners aren't even in the metric themselves.
Well, yeah,
Their
exactly.
staff.
I mean, they're not, they've invested the money, they're owners, but they're not working it every day.
Yeah.
Like Commissioner Roy?
Yeah. So the magic wand thing is we want texting capability.
Yes, if that doesn't work, then I'm not sure.
Yeah.
How else?
Yeah, no, I agree. My last question is around the extensions and the prorated fees. And do you think that's a source of confusion? Because then they get a new date based on that. And has that been a source of confusion for anybody?
It has, I must say, I haven't seen that. For those that know about our extension process and utilize them, they are aware of their extension date, their expiration date, and that's why. But it has happened where we've had a few licensees that didn't realize that they were expiring until the very last minute, and that's when they will apply for the extension. And then I think after that, they keep a closer eye on when they expire.
I guess, so if Kim Roy's Cannabis, I applied for extension, I got a compliant HCA. And so now my extension is no longer needed, but now I have a new renewal date. Okay, and that's communicated, so like, there's no confusion there, because it's confusing.
Yes, no, they get, the information that they've been extended, if they're final licensure or whatever, they get a new certificate with their new dates, so they.
Can I just inquire, so that means they have like a new birthday?
Yes.
Essentially, right, essentially.
I thought that was like a standing head, and then we did that. Oh.
Right.
Okay, Commissioner Bennett, I'm getting back to your original, but you're gonna be armed. I'm glad we had this, yes.
Point, one other thing I noticed in today's batch was there was one or maybe two with expiration dates that were like yesterday or in the last couple of days. When they're like, and I'm assuming that given that very small gap, they don't go through the whole process of paying a prorated fee. When we approve it now, is it explicitly retroactive to the date?
So I would have to look at the specific instances you're talking about. We are allowed to give up to 5 days of administrative extension for the benefit to allow them to get to public meeting. But I would have to look at the specific instance to see. Typically, the renewal goes in effect from the date that's listed for expiration on the license.
Okay.
Executive Director Hearn.
Thank you, Madam Chair. I think it probably overlaps with the last question from Commissioner Benedon, and I think it tracks with the chair's points in the past that the team does an excellent job of trying to support folks who might need some assistance at the end without highlighting the specific licensee in this group. I think one of the examples, I just want to give kudos to the investigator through Director Enos, who was tracking down somebody that was at risk last week, and then working with Director Koval to make sure that everything got in and it got on the agenda to avoid a shutdown. So obviously, we'd like to avoid that. That was a significant amount of work and stress on the staff to have to do that. But I think it just demonstrates that obviously staff is working hard to make sure that these issues are resolved if they can be. They can't always be. But kudos to Director Enos and Director Koval and their staffs to get that done.
Commissioner Roy.
My question is around the certificates of good
I
standing.
was just gonna bring that up. You read my mind. That was gonna be my last final.
Yeah, and so that is, that means they owe money to DOR.
Right.
And that is, statutorily, we cannot, they have to be in good standing. So that ties our hands.
Correct. And again, even in terms of extensions, we can only allow up to 120 days for any reason, which would include certificates of good standing. But after they've utilized those 120 days, they cannot get any more extensions. So unless they enter into a payment plan and are compliant with it, in which case DOR would release them. It's called a tax compliance letter. They would be unable to receive certificates of good standing. And so that's not the final reason. That's another reason that we see people sometimes stall with submitting their applications, because it's either that they've used the 120 days of extensions and they still weren't able to acquire the certificates of good standing and are, trying to press for time and wait till the very, hoping that as closer as it gets to their expiration date, they're going to be able to get either a letter of compliance or a certificate of good standing.
Thank you, Commissioner Roy.
Okay, so what if you have that scenario that they don't have the letter of good standing and they don't have a compliant HCA and they can go up to 365, that would give them time.
Right. If they didn't have a compliant HC, then definitely they could, use extensions for HCA related reasons. And during that time, presumably, use.
Thank you.
You're welcome.
Further questions or comments from my fellow commissioners? So, we good? So anyway, now moving on to staff recommendations on renewal licenses. I will entertain a motion as a group from in this section 6, the licenses numbered 1 through 69 on our board book. Commissioner Benedon, I will entertain a motion to approve the staff recommendation on renewal licenses.
So moved.
Commissioner Roy, do I hear a second?
Second.
Having been moved and seconded, I will call the roll. Commissioner Benedon.
Aye.
Commissioner Roy.
Aye.
Commissioner Stebbins.
Aye.
Chair votes aye. That is passed unanimously. And then moving on to provisional licenses.
The applicant here is Green Meadow Farm LLC. The proposed dispensing location is 239 Boston Post Road West, located in Marlboro. They are seeking a medical treatment center license. The applicant received general review. Commission staff has reviewed the application for compliance with applicable laws and regulations and are presenting it for the commission's review and vote.
Thank you. Are there any?
Yes.
Oh, congratulations.
Thank you.
Yep. Are there any questions or comments from my fellow commissioners regarding Green Meadow Farm LLC? Hearing none, I will entertain a motion to approve the provisional license of Green Meadow Farm LLC. Commissioner Benedon, will you make that motion?
So moved.
Commissioner Roy, will you second that?
Second.
Having been moved and seconded, I will call the roll. Commissioner Benedon,
Aye.
Commissioner Roy,
Aye.
Commissioner Stebbins.
Aye.
Chair votes aye. It passes unanimously. Mellow Tiger LLC.
The applicant here is Mellow Tiger LLC. The proposed location is 67 Central Street, located in Southbridge. They are seeking a marijuana retail license. The applicant received general review. Commission staff has reviewed the application for compliance with applicable laws and regulations and are presenting it for commission's review and vote.
Thank you. Are there any questions or comments regarding this license? Hearing none. Commissioner Stebbins, do I hear a motion to approve the provisional license of Mellow Tiger LLC?
So moved.
Commissioner Roy, do I hear a second?
Second.
Having been moved and seconded, I will call the roll. Commissioner Benedon,
Aye.
Commissioner Roy,
Aye.
Commissioner Stebbins.
Aye.
Chair votes aye, it passes unanimously. Saroma LLC.
The applicant here is Saroma LLC. The proposed location is 325 State Road, located in Phillipston. They are seeking a marijuana retail license. The applicant received general review. Commission staff has reviewed the application for compliance with applicable laws and regulations and are presenting it for commission's review and vote.
Thank you very much. Any questions or comments? Hearing none. Commissioner Stebbins, do I hear a motion to approve the provisional license of Saroma LLC? Thank you. Commissioner Roy, do I hear a second?
Second.
Excuse me. Having this motion been moved and seconded, I will call the roll. Commissioner Benedon,
Aye.
Commissioner Roy,
Aye.
Commissioner Stebbins.
Aye.
Chair votes aye, passes unanimously. Westfield Ultra Premium LLC.
The applicant here is Westfield Ultra Premium LLC. This is a co-located establishment with a proposed location of 98 Sergeant TM Dion Way, located in Westfield. They are seeking a marijuana cultivation tier 4 indoor product manufacturing and a retail license. This applicant received expedited review as a social equity participant. Commission staff has reviewed the application for compliance with the applicable laws and regulations and are presenting it for commission's review and vote.
Thank you. Are there any questions or comments? Hearing none. Commissioner Stebbins, do I hear a motion to approve the provisional license of Westfield Ultra Premium LLC?
So moved.
Commissioner Roy, do I hear a second?
Second.
Having been moved and seconded, I will call the roll. Commissioner Benedon, Commissioner Roy, Commissioner Stebbins.
Aye.
Chair votes aye, it passes unanimously. Moving on to that was for the marijuana cultivator. Moving on to Westfield Ultra Premium LLC, number MPN 282361, product manufacturing.
The applicant here is Westfield Ultra Premium LLC. The proposed location is 98 Sergeant TM Dion Way, located in Westfield. They are seeking a marijuana product manufacturing license. The applicant received expedited review as a social equity participant. Commission staff has reviewed the application for compliance with applicable laws and regulations and are presenting it for the commission's review and vote.
Thank you. Any questions or comments? Hearing none. Commissioner Stebbins, do I hear a motion regarding the approval of Westfield Ultra Premium LLC, number MPN 282361?
So moved.
Do I hear a second? Commissioner Roy?
Second.
Having been moved and seconded, I'll take a call the roll. Commissioner Benedon, Commissioner Roy,
Aye.
Commissioner Stebbins.
Aye.
Chair votes aye, it passes unanimously. Westfield Ultra Premium, number MRN 285415.
The applicant here is Westfield Ultra Premium LLC. The proposed location is 98 Sergeant TM Dion Way, located in Westfield. They are seeking a marijuana retail license. The applicant received expedited review as a social equity participant. Commission staff has reviewed the application for compliance with applicable laws and regulations and are presenting it for commission's review and vote.
Any questions or comments from my fellow commissioners? Hearing none. Commissioner Benedon, I will entertain a motion to approve the provisional license of Westfield Ultra Premium LLC, number MRN 285415.
So moved.
Commissioner Roy, do I hear a second?
Second.
Having been moved and seconded, I will take a call the roll. Commissioner Benedon, Commissioner Roy,
Aye.
Commissioner Stebbins.
Aye.
Chair votes aye, passes unanimously. And moving on to staff recommendations on final licenses, which are voted on as a group, and I believe we had one recusal. Commissioner Roy will be recusing on Resonate. So that being said, can I get a recommendation from the staff regarding final license approval? These are done as a group, so we will do. We will do 1 through 3 as a group. Then we can all vote. So Commissioner Benedon, I will entertain a motion to approve the final licenses of J.O. Worcester, Surf's Up Cannabis, Webster Cannabis. Do I hear that motion?
So moved.
Commissioner Roy, do I hear it seconded?
Second.
Commissioner Stebbins, having been moved and seconded, I'll take a call the roll. Commissioner Stebbins,
Yes.
Commissioner Roy,
Aye.
Commissioner Benedon,
Aye.
chair votes aye. And now we will do separately Resonate Incorporated.
So I have to leave the room because you just have to leave the room. Is that necessary? Fine.
I don't think.
Okay, they used to-
I don't, do that, but I don't think we need to.
Not
I
necessarily.
will not be influenced by your presence.
Yeah.
Okay, thank you.
I will be, but no, yeah, anyway, Commissioner Benedon, do I hear a motion to approve the final license for Resonate Incorporated?
So moved.
Commissioner Stebbins, do I hear a second?
Second.
Having been moved and seconded, I will take a call the roll. Commissioner Benedon, Commissioner Roy, okay, and Commissioner Stebbins.
Aye.
Chair votes aye. It passes 3 in favor, 1 abstaining. So we are now looking at staff recommendations on responsible vendor training renewals. Leafy Greens Agency LLC.
Okay, the applicant here is Leaf.
Commissioner Roy, do you think we did that wrong?
I usually recuse. I think we need to revote because I usually.
I'm happy to have you-
Recuse and don't vote at all when I recuse as opposed to voting an abstention.
I'm happy to, would our general counsel like to opine? My sense is that since I don't believe you have an actual conflict, but you are doing this through an abundance.
Since day one, I've always
Right.
recused on this. I have filed
Disclosures.
disclosures. So
If you're more comfortable, I'm happy to,
I've always done it that way. So I don't know for consistency, just recuse.
the general counsel, do you have a thought on whether or not?
Chair, per prior practice, that's to Commissioner Duation of the past.
So how do we undo what we just did?
So you,
We
Motion to reconsider.
take a motion to reconsider. Yeah. Commissioner Stebbins, I'll entertain a motion to reconsider.
So moved.
Do I hear a second on that?
Second.
Having been moved and seconded, vote to reconsider. Commissioner Benedon, Commissioner Stebbins.
Aye.
Chair votes aye. We'll take the reconsidered motion. So now, again, we will vote on the final license of Resonate Incorporated. Do I hear a motion, Commissioner Benedon?
So moved.
Do I hear a second, Commissioner Stebbins?
Second.
Having been moved and seconded, I will call the roll. Commissioner Benedon, Commissioner Roy. Wait a minute.
Vote at all.
Oh, all right. Okay. Gotcha. I see what you're saying. Commissioner Stebbins.
Aye.
Chair votes aye. It passes 3 in favor with 1 recusing. Okay, all right. Okay, staff recommendations on responsible vendor training renewals. Leafy Green Agency LLC.
The applicant here is Leafy Green Agency LLC. They are seeking to be renewed for an additional 2-year certification to provide basic core curriculum training in the responsible vendor training program. Since their original certification date, they have provided instruction for 621 marijuana establishment and medical marijuana treatment center agents. Commission staff has reviewed the application for compliance with applicable laws and regulations and are presenting it for the commission's review and vote.
Thank you. Are there any questions or comments from my fellow commissioners? Hearing none, I will take the call the roll. Commissioner Benedon, do I hear a motion to approve the responsible vendor training renewal of Leafy Green Agency?
So moved.
Do I hear a second, Commissioner Roy?
Second.
Having been moved and seconded, I will take a call the roll. Commissioner Benedon, Commissioner Roy,
Aye.
Commissioner Stebbins.
Aye.
Chair votes aye. It passes unanimously. So we are done with the licensing portion of the meeting. So CFAO, can you get a sense of how, I just want to be just making sure that we did a real marathon yesterday and we stretched a lot of things yesterday trying to get through. So I just want to make sure I think we probably can get through this budget recommendation and then maybe break for lunch about 12:15, 12:30. And unless anybody needs a current break right now, we good? Okay, all right, thank you. Do you want to?
Borderline, 5 minutes.
Can I take, yeah, okay, because I just want to be respectful. Yes, no, I'm just saying, yesterday was, we were trying to get done so quickly that we were not paying attention to biologies. So I will entertain a motion from Commissioner Roy to take a recess until 11:55.
Sounds good. Thank you.
Do I hear a second? Commissioner Stebbins, having been moved and seconded, I'll call the roll. All those in favor say aye. Opposed? Ayes have it. Okay, there we go. Sorry about that. Reconvening the Cannabis Commission and turning it over to our CFAO, Lisa Schlegel, for the 2027 budget discussion.
Yeah. Thank you, Chair. Good afternoon, Chair, Commissioners. Thank you for the opportunity to present our FY27 budget proposal. Departments began working with the Budget Director in August of this prior year to prepare budget requests for the FY27 based on Commission priorities, including social consumption, testing protocols, and improvements to IT platforms. I'd like to take the time to review the proposal for the board consideration and vote today. If we can go to the first slide. We do have a new slide that we're rolling out this year. I'm not going to go into the complete detail of everything on here, but if you look at the first column on this is revenue that the cannabis industry is generating for the state of Massachusetts and those buckets. Top is fines and fees. We have excise tax. We have cannabis local sales tax and the state sales tax. I'm only going to concentrate on what's really going into the marijuana regulation fund and what the spending is from that, which is at the top. So the only revenue that comes through the commission are the fines and fees. The state excise tax goes directly to the state. We're only managing the fines and fees. Everything goes to the marijuana regulation fund along with those state excise tax. 15% of those funds go to the Cannabis Social Equity Trust Fund, which provides grants for businesses managed by the Executive Office of Economic Development. The commission does not have any management or responsibility for those grants from the Social Equity Trust Fund. The 85% remaining in the Marijuana Regulation Fund goes to the legislature for appropriation. There are currently 7 agencies that are funded with funds from the Marijuana Regulation Fund, and those are the ones you're seeing in the very final column there. If we go to the next slide,
this is new, like you said, and thank you to the chair, to our CFAO. So I found this interesting because there were things I didn't know on this slide. And so for folks, the buckets,
Excuse me, could you go back so we can be, while you're talking, leave me looking at it? Thank you.
So, for those listening, like you said, the fines and the fees and the excise tax, the fines and the fees go directly to the Marijuana Regulation Fund. The excise tax also supplements the Marijuana Regulation Fund, but the sales tax does not. It goes to the general fund. And I didn't know that some of that money is appropriated to the MBTA and the Mass School Building Authority. I didn't know that till I read that on the slide. So it's interesting to see what this industry generates and the different agencies it's able to assist. So thank you. I had no idea.
Thank you. Just for
When you first put this slide up and we were going through it, I had no idea either. So this is a very interesting breakdown. So thank you for doing that.
And the ED can clarify, but I think Mass Budget and Policy was instrumental in putting together a lot of the slide.
Right.
We took some of that information and added to it as well.
Yes, there was a report. I think we did help them promote it as well, where they looked at a number of the benefits coming out of the industry. They were focused on equity as well, but they did add a number of items. And this is something that the CFAO and the Treasurer, Commissioner Roy, Commissioner Stebbins, and I presented as well last year, where we put percentages, and that may be part of a presentation in the future to Joint Ways Means. But this is really to help folks, not necessarily looking at the dollars, but more about how the money flows to understand all the benefits.
Thank you. Go ahead. Any other questions? Thank you, Chief Schlegel. Sorry.
Next slide, please. So again, for those 7 agencies that were listed on the final column, this just represents the percentages that those agencies are getting. Now, 76%, the majority of it is going to the Bureau of Substance Abuse Services. 8% through DPH is going to the Department of Higher Education. So those funds go through all the state colleges, and community colleges get a portion of those funds. 4% goes to the Executive Office of Public Safety and Security, 1% to MDAR, and 11% to the Cannabis Control Commission, broken down 9% for our operating and 2% to the medical program.
Commissioner Roy?
And thank you. I had requested this pie chart last year. So I'm just curious, and this is just like throwing out little tongue in cheek. I wonder how BSAS was funded prior to cannabis legalization, because we're funding 76% of what we generate is going to BSAS. I don't know the answer to that. It's just like we fund so much of BSAS, which is definitely worthy, addiction services, worthy. I'm just wondering,
We can work with
Yeah,
to
yeah,
go
okay.
back and look at those figures for prior years, prior to,
Thank you.
Thank you. Go ahead, Chief Schlegel.
and if there's no other questions on this slide, we can go to the next slide,
Thank you.
which is the dollar amounts that we've seen over the last few years and where we are with FY '26, 6 months in. Now, these figures were run right after the first of the year, so there is some lag because especially with excise tax, there is a delay in those. So, but just to go through non-tax revenue, again, the first line is what's coming through the commission. We have seen a decline in years. Number one, that's because we have seen some surrendered licenses. We've seen agent registration declines, but also we've changed our agent registration back in FY '22. Agents were paying annually. That was changed to a triannual payment, so we're not seeing that revenue.
Commissioner Roy.
So if we're on trajectory, we're only going to get 16.6 million for the year versus 19.2 the year before.
I would like to clarify that a lot of that has to do with, there may be very well be some declines, but we're also looking at these extensions. As Director Koval mentioned earlier, we're receiving 100 extensions a month. So where we would have seen an annual renewal come in, maybe in the beginning, first part of the year, now they're paying every 120 days. So there's also a delay in that revenue coming in because they're purchasing their extensions for a shorter period than an annual renewal. So it will make it up. We hope to be making it up.
It's just delayed.
But they're paying a prorated fee.
Correct. But if they were up for renewal in prior years between July and December, they would have paid a full
amount
So
upfront.
for example, on a $50,000 medical license,
Right.
we would get the 50,000. Now we're getting 16. And then another 120 days later, we're getting another 16.
Because these numbers have a hard stop, and so we're basically delaying.
Correct.
Yeah, but also our fines were way up from previous years.
Correct. In FY '25, we had a lot of fines.
A lot of fines. Well, do we know the total amount? Was it hovering around $1 million?
Last year, I believe it was 600,000, if I'm.
Okay. So without those, I mean, not saying we don't use that as a revenue generator at all,
Correct.
but
Right. So yeah, I
fines.
think there is some delay. I think for the commission, we are monitoring that. We're doing some analytics, as we've said, based on projections and where we are. Like we've seen some surrendered licenses. We've seen a number of declines in agent fees and agent registrations. So that is going to affect our revenue. We are making it up on the tax side. I know that's not commission based, but if you can see even at this, where I said the 156,000 for the first 6 months, to me is a little low. So there's some lag there. But I definitely see overall that we will meet or definitely beat the 308,000 in overall revenue that the industry generated in the prior year. To the next slide, if there's no additional questions here.
I don't have any additional questions. Anybody? Thank you.
Next slide, please. Okay, this is where we're getting into the spending side of our budget. As you can see, the first 3 columns represent our budget requests to the legislature and ANF. FY '25, FY '26, and FY '27, if we're just looking at the right light green at the bottom, that's our maintenance request. The gray at the top represents our expansion requests. We have not received any expansion requests over the last few years, though that number does keep increasing as we keep requesting a number of items. But if you're looking at just the maintenance requests, we have remained fairly consistent on those numbers. That's maintenance is our providing the same level of service year over year. So it does take into account increases for merit or COLA increases to staff or contractual increases. The final 2 columns in the bright green on the right represent our actual appropriation received. So again, looking at what we've requested and what we've received, it's much lower. For FY '26 in particular, we received an appropriation of $19.7 million, which is 85% of our maintenance request. Again, taking expansion out of the equation because we didn't even get that. So that's a $3.4 million reduction in expenses that we had to account for in FY '26 this year, mainly done. Was the $3.4 million reduction in expenses between what we had requested in maintenance for current operations and what we received in that 19.7.
Thank you.
Next slide, please. So this slide represents our maintenance increases. And essentially, all we're asking for in maintenance increases for FY '27 is basically that $3.4 million that we lost last year. It actually comes out to 3.6, again, because of some merit COLA increases. The breakdown of that, again, just to get us back to what we need for maintenance, is payroll cost, $3 million. That would fully fund the commission payroll for the 11 positions that are currently frozen this year and annualize the delayed hiring that occurred in FY '26. We started this year, I believe, with 8 or 9 positions that were in process or in recruitment. Those hirings were happening over the last 6 months slowly. So to annualize those salaries, that would be in that $3 million for next year. 2 of those positions that we are still recruiting on, and that would be the Associate General Counsel position and the Director of Testing. So those were budgeted for this year. We are getting some savings, so that goes into that $3 million. If we get those positions filled, next year we would need the annual cost for those.
Can I ask for the Executive Director Hearn, where are we in terms of and this is probably a conversation we're going to have offline with the Director of Testing. I would really like to be involved, in taking a look at that, because I do think that, especially as we're going to be doing regulations, it would be, are we anywhere with that? Are we advertising? Are we going back and looking at the resumes that previously came in, maybe to look at a, second choice for testing?
Thank you, Madam Chair. I believe where we are right now with the CFAO and CPO is getting prepared to post a number of positions, including what is now the Director of Testing Compliance, with the red lines that were approved by the commissioners, and with the review of where we are with the current budget, the projection that we can post those positions. So we have not yet received resumes, no, but we will keep the board updated.
I'm on that. I'm obviously they're all important positions, but I'm especially interested in the testing position.
I think that we would be looking to get that out shortly, including at least one other position, and then generally speaking, leave that open for a few weeks for resume review and folks to review the updated job description. So maybe a late February timeline for discussing or updating where that is in the recruitment.
February for discussing or
getting into. Oh, no. I think we can post in January.
Oh, all right. Okay. Thank you. Thanks, Commissioner Roy.
My question is around the public education and awareness. So this is maintenance increases. So I see a reinstate funding for educational materials. Are those palm cards?
RAC cards, yes.
Okay.
The RAC cards are give out.
Okay, and SCP outreach. So this doesn't include social consumption. This is like what we already had. We want to fund it and.
Exactly. So our current budget, what we have in our budget for FY '26, essentially reinstating those costs. So nothing new. Those would all go into expansionary. So that will be on the next slide.
Could I get a further understanding? And I should have asked this earlier, but what else is in this 130,000? What else, and where do those palm cards go?
They're used for events, and then they're also used, I think, for SCP events. So when they're doing some outreach for that, whenever they have any events, they have those. I know last year they did some medical marijuana outreach and here at the commission, and they gave those out. There's also printing that goes out, and there's print storage of the documents that they keep for education with digital, and they have storage documents for that. So as we increase those storage of those educational materials, there's some cost there as well.
What do you mean storage of educational?
These storage PDFs of any educational material as we're required to do.
Okay.
And there's some cost involved in that. And as we get more and more, those storage costs goes up.
Okay, thank you. Anybody with additional questions on this slide? Thank you. Thank you. You can keep going.
Okay, we can go to the next slide if there's no more questions on maintenance. And this is the bigger increase, and these are our expansionary requests. So these are new initiatives that we do not have funding for right now. And I'll go into a little bit more detail on these line items because there's some large dollar amounts here. $3.8 million for social consumption rollout. So there's a number of items within that. Increased staffing across multiple departments for the 3 new licensing types. Staffing requests include additional positions and equipment to staff those, whether it's laptops, scanners for investigators. The total projected cost for staffing and staffing expenses is $2 million. That would provide 6 positions in licensing, 6 positions in investigations, 2 trainers, 2 enforcement counsel, 2 in legal, and 3 within IT. Additional costs under social consumption is what we just talked about, that $1.5 million for public education to raise awareness of cannabis impaired driving and responsibilities for on-site consumption. We believe a major public awareness campaign is necessary as we roll out these licenses. Other items within this social consumption, we know there's going to be additional agents. As you're aware, agent costs or patient costs or any agent ID cards, that expense falls to the commission. So depending on the number of new agents or licensees that come on board, there'll be some cost associated with that. Additional IT upgrades to account for the social consumption is $225,000. And with this new additional testing. So there's $150,000 built in for additional testing. And the only thing I want to note with social consumption is it was pointed out to me by INE with the rollout of Chapter 180, no funding came in with that. So any of that costs for additional staffing was not there. Any IT upgrade costs was not there. So they've always been a little behind. It delayed the rollout of social consumption because there wasn't funding there available to these initiatives. Staff is hoping to get in front of that this time, request that social consumption.
Delayed 180.
Delayed 180.
Yes,
Yeah.
yes, it was delayed. So we're hoping to get the funding in the door so we can roll out social consumption smoothly without delays. The next largest item on here is our $2.8 million for IT costs. We're all aware of the licensing upgrade replacement that we've been talking about. That's going to cost about $2 million. We originally had costs in here for MMJOS. We have gotten funding for that, as we're all aware. We got $750,000, which will cross into next year. But rather than reduce this, there's other things. We've got requests for SOC audit. We had that SOC prep audit. So there's some IT infrastructure there, metric upgrades. So we're keeping the request in there because there's always IT costs that we need. So we've left that 2.8 million in there. The next item that's a large ask is the INE compliance testing. This is broken up into 3 separate asks of 1.7 million. The first one is for $500,000 request for financial audits of licensees by a third party. These could be complete audits of licensees or a more targeted audience for specific functions. This requirement for the commission to audit licensees is under MGL 94G, Section 18. Up until this point, we have had done very little with a limited budget of $5,000 to $20,000 a year. So that really hasn't been done. It is under our MGLs. So we want to get the ask out there for the funding from the legislature to implement that. The second. Sure.
Thank you, Chair. CFA, just as we're looking at the INE and compliance testing, there's outsourced query review and document storage. Is that related to overall activities or activities, again, specific to compliance testing?
Those are for when a licensee renewals or an agent renews, there's a query check that needs to be done. Current process is for the licensee or the license holder to self-certify that they have done those query reports.
Mhm.
The regulations actually do require us, the commission, to receive the query reports. We are currently not doing that. We're relying on the licensees to self-certify. This would take that away from them, have a third party do that, which would take it again out of the commission, hire a consultant to get those query checks, make sure they're done, review them for any findings or anything that needs to be addressed, and then store the documents outside of our system because Mass CIP currently does not have a mechanism to store those query reports. So this would take it out. Licensing has requested this as the option because it makes it a little bit more objective for the third party to be reviewing those queries than our internal team. And again, so that's another $500,000 cost to do that. Again, it's in our regulations. It's currently not being done, so we wanted to make sure we have the ask out there.
Thank you.
Thanks. Go ahead, thank you.
The final item under I&E is for a reference lab. Long waited, long requested. That is a $700,000 ask. That would include working with DCAM on a procurement to find a space to have a lab, equipping the lab with equipment, and staffing. It would increase 2 positions to run the lab to our lab analyst team. The next, there's just some smaller amounts.
Commissioner Roy?
CFAO, do we have potential sites in mind for a reference lab?
Currently, the way I understand it, there are 2 independent testing labs that are no longer in business. We would have to go through DCAM again, because there was a state agency and leasing space. They could use those as they can reach out to them and look for space, or they can post a procurement and see which fits best. I know I&E is looking for something centralized in the state. So there are some that do fit that, but again, it would be us to go through DCAM in order to procure that space for us.
My second, if I may, my second question is around the quarries. Do we have a certain retention period where we need to keep them? Do we know?
I don't know. I would have to reach out to
Okay.
licensing for clarification on that.
Okay.
Thank you, Lisa.
Okay, next item is for, I think we've talked a little bit about this. There's a working group on that, $200,000 to secure a vendor to help with the Center for Cannabis Research, whether it's a study or implementing that, looking at grant funding to support it. Just some preliminary dollars requested to investigate that. The next item, again, another $200,000 for SEP program criteria study. And again, this would be a third-party consultant to evaluate the EPCO program eligibility criteria, including racial disparity, equity considerations, with an emphasis on evaluating areas of disproportionate impact.
Okay, how will that differ? Can you just walk me through that? Because we do have the Donahue Institute report that we still have not accepted, that we paid $200,000 for. So how will that be differentiated, or do we need anybody from that team to explain what that is?
In my discussions with that SCP, I know Celia has been out, so I did not have that conversation with her. It's different. It's a different study. It wouldn't, but this is more the mapping, the areas of disproportionate impact, determine the criteria that they're currently using and whether we should be sticking with the current criteria or making changes. But SCP
I'd like a little more detail on that, because I think that this was also part of the conversation that we were having yesterday in extending the exclusivity, or beginning the process of extending the exclusivity period. It's once again how we're going to measure what is it that we do for social equity. And I don't know if that's what is anticipated there, but I would love to get a presentation, and maybe with you to help with that, to understand that. And maybe Commissioner Benedon, who has a particular special, given the seat that she sits in. I would just like to understand that, because I think one of the things I want to make sure happens is that we have commissioner voices looking at that to determine, taking back that we have just voted and gotten the another Donahue Institute report that is talking about what the potential deficiencies are, and making sure that we're spending money in the right way, so that and that commissioners have an opportunity to weigh in on that. So I'd love to see if maybe we'd get a meeting and ask the social justice appointee to work with me on that.
Chair,
Commissioner
I
Ray.
may, through you to the executive director.
Oh, sorry.
So regarding the report that the chair just referenced, the DIA report out of the Donahue Institute. So yesterday, it was great having Mr. Melnick here with us and his team virtual to answer any questions. We got that report December 22nd. So literally we accepted a 120-page report with less than 4 weeks. Now we have the second, that costs $75,000, I believe, approximately. We have a $200,000 report dated April 2021 that half the board wants to accept and use it as a tool, and some folks still have questions. I don't think Commissioner Benedon was here. So could we invite him back so we could go through this, be afforded the same opportunity to just have questions on that report? Because, I'd like to accept Vernon Hill And so, so I'd love we invested $200,000. We've all had years to look at and absorb and understand this report. And for whatever reason, there's been a reluctance to accept it. So I'm wondering if we could invite him back to do this again.
Thank you, Madam Chair. And if I don't mind, I'll answer the question and kind of expand on a couple of thoughts as well. So I do believe, obviously, we had the scope of work, which was referenced with UMass Donahue yesterday, and they came in to present and the board took action. We can certainly work with UMass Donahue on seeing if they would be amenable to come back on the initial report.
He doesn't have to come in person. I mean, I'm happy to have him, yeah.
Virtually,
He
yep.
doesn't-
And so the CFAO and I obviously had worked with a contract with them, and so we can inquire and see. Obviously, there would be somewhat of a cost, but I'm sure it's manageable, especially if you're all looking for them to be remote. Have that discussion as well, which I know we started, and you had a listening session, and so you can come back to that, and we can ask them and get a quote and make sure everybody's comfortable with that engagement. And I would say for this one, I think the biggest thing, and I appreciate the chair's point of, potentially having a follow-up specific conversation to this. I look at this part of the budget request as if there is any additional questions that you have when you have that conversation, or if there's other questions that pose that are not necessarily the DI map specifically. I think we had a lot of things yesterday that we see as things that the commission is going to want to discuss, as addressing barriers. That was kind of a lot of the focus there. So I think by having this in here gives us the opportunity going into FY27, when we're through the promulgation process and talking about addressing those barriers, which was a main focus of the report with recommendations from UMass Donahue, it gives us the opportunity to be prepared to do those types of things, whether it's addressing the DIA map or not. And so again, to the CFAO's point, this is not specifically about that report. This is really kind of, I think it marries well with the discussion that we had yesterday. So I'd be happy to follow up on your specific request to see if UMass Donahue could come back on that, as the board is looking to come back to it on this request. If there's any additional information needed today, happy to discuss that. Otherwise, to the chair's point, happy to have kind of a longer discussion after we go through the budget to talk about what we may be looking for in that, which I think is probably going to be more tied to our discussion yesterday. Thank you.
Thank you. And if I can also just, noting that one of the items that we're looking at right now is ADA compliance for the website, because I had a number of years ago, I had a conversation with the Disability Law Foundation, and that is actually one of the cohorts that we are supposed to be supporting and paying attention to. So I'm pleased to see that there.
Okay, great. And then really the only other line item is that there is a $459,000 for staffing. Again, administrative support, essentially 5 positions. Some of these are brand new positions, so those would go to the board for approval if we were able to get the funding. Some of them are new. We do have a grant writer position we're requesting, which would be helpful in raising funds. There's a.
I do mean to interrupt you. Anyway, remember we were talking about, Dr. Johnson, has been very successful in being added to grants, but because we don't have the trust for the mechanism. Is there anything, and again, obviously we, unfortunately, after every meeting you walk away, laden with new things to do. But in terms of setting up a trust where we can take those funds that actually, again, I don't know all the limitations in terms of legally accepting it and spending it. But I think that you had said that we could set up a trust, and setting up a trust legally doesn't appear, to be that difficult to process. So we don't need it today, but if we can actually look at that, because I do think that we're missing opportunities to get some more direct funds that support some of the work that's going on, and especially if we are looking at maybe a grant writer. And I don't know if that's, we're talking about a grant writer, but we don't have a place to put it. We don't get to keep it. So, it feels like a kind of chicken and egg thing. So, I know we have talked about it, but I think that would be, helpful to see maybe our legal team. Commissioner Roy?
Is it possible to set up the CCRP as a 501c3?
Yes, technically it is, but there's a lot of considerations to take in that. As a 501c3, they would have their own tax ID number.
Mm-hmm.
They would have their own tax returns. So there is going to be additional expense associated with that.
Mm-hmm.
Normally, a 501c3 would have their own board of directors.
Yep.
So there are a lot of considerations in that. They would be required to get an annual audit. So again, a lot of expenses, tax returns. definitely explore that as an option going down the road and making sure we have all those checkpoints covered as what would be required and what approvals we would need to do that.
And again, we're having some conversations and this is obviously a complex, this is not simple, that's not simple. Setting up a trust to bring the money in, would be more simple, but setting up something independent like that. But I've, told the story when I ran for governor in 2002, I talked about setting up, an independent, quasi-independent agency to do research on healthcare disparities. And, I ran in 2002, and I think they just established it 2.5 years ago. And so that was, and that is one of the, there is a model there. And so this also might be something that in the conversations that we explore with UMass, there might be some way to work with them, where we do some shared resources to make something like that happen, because they already are interested. They're already applying for licenses to do research, more scientific research, affiliated with their School of Agriculture. But, we've, as a matter of fact, when Dr. Johnson and I wrote the op-ed piece for the Globe that was published earlier in the week, they are supportive of this issue. And obviously with the potential rescheduling on the federal level, this could make things a lot easier. So I'd just love to keep that conversation going. So thank you.
Sure. And if I may, with the grants, yes.
We may want to have a conversation with you there. And maybe, some of the folks on their side to understand what a structure could be if a future partner or a possible, quasi-independent could take research, make them truly independent. And again, that was actually one of the reasons that we had to spend an extra $75,000 for the UMass, for the Donahue Institute to do the study that we listened to yesterday. It's because we needed to have that independence of the research to color some of our policies. So that might be, I'd love to, we're going to continue having those conversations, but it might be worthwhile to have you join us in something like that. Thank you. Commissioner Roy?
Before we move on from this slide, my question is on consultant increase of 100K. So I see in IT, we account for the SOC audit, that line item. So the consultant increase, is that testing? Can you speak to that a little bit?
This is administrative. It's basically a catch-all. I know HR is looking at having a consultant review our HR policies. There's 4 phases of rewriting all our policies. Right now, we are having a legal review of that, whether it's a labor or employment council reviewing those. So there is some cost in that. But it is basically a catch-all for any consulting costs, for
including testing.
That it would be separate.
Okay.
That falls under, there is definitely testing that is under.
Oh, I see it. Increased testing compliance. Is that ID line?
Yes, there is some test, right. There is some testing compliance in there. That would be under. We have it into our maintenance, definitely.
Yep.
And I know there is additional testing
Expansionary as well.
under the testing lab. So we
Yeah.
do have the reference lab in there, and there is increased testing. I see 150,000 under programmatic services. So it's under a different line item, but it does fall under.
Okay. Thank you.
INE compliance testing.
Thank you.
All right, so if no other questions, we can go to the final slide. And this is basically everything we've just talked about, just in the format we provide to the legislature and A&F by line item. So we can go through the specifics. So everything we've talked about falls into one of these buckets. So just looking at the maintenance requests, that's our biggest increase. We're going from 13 million to 16 million. And again, as I said, the 16 million will fund our current org chart as it is. The 18 million would be all those additional positions for social consumption or reference lab positions we're asking for here. BB is our training. Payroll tax is just a subsidiary percentage of our payroll. Office and admin, again, there's some testing. I'm sorry, that's where you're seeing the public education printing costs, the rack cards and all that. The increase would be vehicles for new investigators. And just going down, GG is where you would see the reference lab leasing. The consultant is what you were just referring to, Commissioner Roy, and HH. So you would see the testing increases under there. Same with programmatic. The big increase under programmatic is our public education and awareness. So it's just what we've talked about, but what buckets they fall into here. And again, the largest other item after payroll would be our IT services.
And this is helpful. Anybody who's gone to see through on the controller's website trying to find stuff, it's really hard. So thank you for putting this guide out here because it helps find a number of different items. Commissioner Stebbins?
Sure. Thank you, Chair. CFAO under FF. We're not asking for a big increase, but, you know, we've talked a lot about changing up industry badging, maybe using an electronic badging as opposed to, I haven't got mine on me, but the old laminated stuff. Any progress or update or any traction as to how we can make that adjustment?
We have, and I've discussed that with the CTIO, and it is listed as a potential of our MMJOS funding. So we are currently out to procurement on that. We received $750,000 from EOTS.
Right.
As part of that, we are hoping, if it's not right away, in the second phase, so the new system would be compatible with implementing electronic badging. It's just what we have the funding for it.
If I may, Chair.
Please, thank you.
That will help us on the medical side. On the industry agent side, we'd still be carrying that cost unless we get the IT. I'm assuming if we get the IT upgrades that we're hoping to get.
It's all part of it, so Paul can.
Okay.
Yes, thank you. Yes, it is all part of it. We are working towards a RFI on digital badging. In fact, the PMT is kicking off at the end of this month. So we'll have additional information coming in the next couple of months as to what is the realm of possibility.
Okay.
Commissioner Roy?
I just want to comment how nimble Paul is for these questions because you're like working, making sure everything's, and then you slide in, answer a question. Okay, Paul, it's not lost. Thank you. It's not lost on me. My question is next step. So, you know, obviously we're going to have meetings up at the State House, and when do we testify? What else can we do to advocate for our needs? You know, myself as treasurer, what can I do to assist? What can we do? I know, you know, we'll be up at the Hill. We'll be you know, testifying. I think there's that in March or April or something like that. But what else, is there anything else we can do as a collective body to advocate?
Yeah, just as a timeline, we submit to the Joint Ways and Means by the end of this month. We will be submitting our proposal to them. We do have a meeting scheduled already with the officers. Yep, we have that chairman office. I think that's at the end of the month. Sometimes that gets rescheduled. I think last year it was maybe February or March by the time we finally get that. We will be testifying in March. So as much outreach as we can do with our legislatures to understand the need and have those meetings and discussions is all beneficial.
This is a conversation that we've had offline, and obviously we're an open meeting now, but working with both our CFAO and our executive director to ensure that we more fully engage our members, our board members to lobby, well, I don't know, as we can say lobby, to approach to the members of the legislature and make sure that we're having those conversations. So we really haven't organized that before. And I do think that, you know, we have a very strong board here, that many have connections with persons up at the State House, but, you know, regardless of connections, to be able to walk in and see a friendly face, it's also important to just bring this expertise with what we're getting here today. So I'll be working with the executive director on that. Commissioner Roy?
So my question is, historically, I thought we always voted to ratify the budget. Historically. So is that something we should do? And secondly, if we do vote to ratify it, should we just send out a little press release like, this is what the board voted in favor of, and these are the reasons why? I guess to the executive director.
Yeah, we vote on the budget.
Thank you, Madam Chair. Yes, we are looking for a vote today. Actually, the next slide, I think, is the summary slide.
Yeah.
We can go to that, but
Okay, yeah.
no, I don't think it's, I think the CFAO can get into the.
Language developed for us.
Yeah, so I think to the question though, certainly we can work with the comms team to promote this presentation. Any additional information, I know there's some questions here that I'm tracking to get answers on. If we feel like we need to incorporate those, I do think that initial slide that we referenced that sort of came out of the mass budget engagement that we've done over the last year, focusing on where the funds are going so that people understand. Certainly, I would say there was a couple notes I took away. It was my second week on the job when we were in Gloucester last year. 2 notes was hemp came up very hot and heavy out of kind of, knowing what was coming, which was not necessarily in our budget request, but was obviously something that was a harbinger. And then the other thing, I would note is that it is critical. And that's one of the things the chair and I have discussed is that people understand that this revenue does not come directly through us, that we are reliant on our appropriation, and that the revenue goes into the MRF and benefits quite a few folks. So we can certainly discuss promoting this now or between now and when we're on the Hill. And I think, it's sort of 2 different things. 1, the needs of the organization, which is reliant on the appropriation, and 2, the benefits of this industry on a number of folks besides just the CCC.
Commissioner Stebbins?
Thank you, Chair. And just to kind of echo some of the points that the ED just made, that first slide that you included that showed where the money comes in, where it goes, and the subsequent pie chart, I think would be helpful in whatever the Ways and Means presentation is this year, because again, last year we had questions of, don't you keep all the licensing fees and things like that. Just doing some quick math, because over the last couple fiscal years, we've been relatively flatlined in terms of our budget. But in July 2023, we had 223 commence operation licensees. As we just saw, we have now 686 active commence ops licensees. That's over a 200% increase. And I would argue our budget has not kept up with that additional work. But active commence ops is 686.
But I think it also begs, Commissioner Bennett, you had your hand up, and I went to Stebbins first.
Thank you. One thing that I just wanted to follow up on when we had our individual discussion about this, a point that I raised, which is that a big part of our expansion request relates to our need to fully and efficiently implement social consumption, which has waited a long time. We finally approved the regulations, and staff needs to have the capacity to do that. And so I had asked if it would be possible to get information from some of the other states on the West Coast that are ahead of us in terms of social consumption, to get some estimates or projections as to the additional revenue to the state that could be generated. We know it could be a year or more before those establishments actually open. And I'm not talking about licensing fees, but the actual tax revenue that will benefit the state and 7 of the agencies, not just us. And I'm wondering if we had any success in finding out what we might be able to tell the legislature we think we will generate in new revenue for the state.
Executive Director Hearn.
Thank you. Thank you, Madam Chair. The government affairs team did reach out to a number of states that have had a longer track record with social consumption and operating businesses. Unfortunately, we weren't able to get sort of a robust response from folks. What we did get was from the state of Nevada, who gave us their metric data for the 2 operating social consumption establishments. And in the aggregate, and this is just confirming as well, what would flow through metric would be cannabis specific. So obviously, as we know in our regs, cannabis sales, if you were to sell a hamburger and a cannabis product, they would be tracked separately, they would be taxed separately. And so generally speaking, just to caveat this is their metric data on 2 licensees operating in the state of Nevada, was gross sales of about.
I just want to, so you're saying as we are going to have, there'll be 2, in essence, separate revenue streams, depending on whether you're eating a burger or you're getting an edible?
The way that the regs write would be that you would be taxed on the burger at this.
No, but I mean in
Massachusetts. Oh, I'm sorry, in Nevada.
Nevada.
All right, in Nevada, my understanding from kind of having pressed based on the data that we did get was that they're giving us the metric sales, which would be specific to the cannabis. And between the 2 licensees in an annualized basis, they saw 1.45 million in gross revenue between those 2 licensees. So on a sales tax basis, you're looking at somewhere between $80,000 and $90,000. And on a what would be our cannabis tax basis, you're looking at about $175,000 in excise. That does not take into account the license fee structure that is in there as well, and that is based on 2 licensees in that state.
And do they also have food, or how is that structured in that state? I mean, do they all, that was my point, is, do they separately tax food in there? Do they serve food? I don't know what the,
My understanding from the licensees, and I can certainly dive deeper, but I believe that at least one of them is more of a lounge scenario, so it would have food as well. And so those would be other sources of revenue for that business, but the cannabis specific revenue generated through metric that they were able to provide us is the 1.45 million annualized.
thank you.
Thank you.
So I apologize, that's not the best data or probably not the most complete data set, but I do think as well, as we talked about with social consumption, there's going to be somewhere between probably 6 to 10 communities who will be the first out of the gate with ordinances and bylaws. Therefore, when we have the license open, that would be the sort of communities that may be ready to go. I don't know, quite honestly, within FY27 that we would see any revenue outside of potential people approaching the license fee structure. So as we look at FY27, I don't want to give the impression that our budget request to gear up for this expansion of the market may entirely offset what our costs would be. And yet I think, as well as obviously we discussed through social consumption, this is new opportunities for the market to grow, and things like hospitality will, evolve over time. And so it's difficult to project. Unfortunately, those other states weren't able to itemize social consumption revenue specifically for us. But we will hopefully continue to work with them on that and see what we can pull for you.
Thank you.
Thank you.
All right, so are you done with your,
Just here's the final screen. So our total ask is 32,927,978. And the commission staff would just recommend approving this budget, and we ask the board to consider a motion to accept this.
okay, I don't think I need any special language other than asking for a motion to accept the budget request as presented to us by our CFAO. Do I hear a motion to accept?
So moved.
Do I hear a second, Commissioner Roy?
Second.
Having been moved and seconded, I will call the roll. Commissioner Benedon?
Aye.
Commissioner Roy?
Aye.
Commissioner Stebbins?
Aye.
Chair votes aye. Unanimously approve the recommendation for the budget request for fiscal year 2027. Thank you very much. Great job. Thank you.
Thank you.
Thank you.
Now, we probably will take a recess now that we've got through the budget and the licensing portion. Do we feel comfortable coming back at 1:30, giving people enough time? And I think everybody has ordered their food. That was a problem yesterday. It took a little while. So I will entertain a motion to take a recess until 1:30 this afternoon. Commissioner Wright, do I hear that motion? Commissioner Stebbins, do I hear a second?
Second.
Having been moved in second, call the roll. All in favor, say aye. Aye, opposed, the ayes have it. So there we go. Very good. Thank you. Reconvening the January 15th meeting of the Cannabis Control Commission. We're going to be turning this over to Commissioner Roy, who will be leading a conversation about the receivership process. As we know, the headwinds facing licensees in the state are continuing to grow stronger. And we also know that on the federal level, bankruptcy is not an option. So receivership is the way many of these businesses that cannot make it or are considering winding down or selling their assets. This is what they must go through. It is a public process, but we're trying to figure out what exactly we do here at the Cannabis Commission, how it is launched, and I'll turn it over to Commissioner Roy.
And thank you, Madam Chair. And I really do think this conversation is ripe for a board discussion. So for my presentation, I'm going to read an opening statement. I do have a short slide deck, and I have shared with my colleagues a form that we're going to discuss later in the presentation. So thank you, Chair. As the Commission continues to strengthen oversight across all areas of licensure, today I would like to address an increasingly important issue, the Commission's role and process when a licensee is placed under court-appointed receivership. We've seen an uptick in court-ordered receivers, 24 to be exact, managing cannabis businesses that remain subject to the Commission's jurisdiction. These situations raise complex questions about who is actually in control of licensed operations, how compliance is maintained, and whether the Commission receives timely and complete information on financial and operational decisions made under receivership. What's become clear is that the Commission's current processes do not provide sufficient visibility into the activities of these court-appointed managers. In practice, this creates uncertainty not only for the Commission, but also for employees at these licensees, investors, consumers, and importantly for public confidence in our oversight system. To address this gap, I am recommending that the Commission establish a mandatory reporting requirement for all court-appointed receivers operating within our license framework. This process would include submission of a standardized form, one I have drafted for discussion today, that captures essential information about the receiver's identity, authority, operational control, compensation, and ongoing compliance measures. This form ensures that the Commission receives uniform, verifiable data and can proactively monitor activities while respecting the authority of the appointing courts. It brings much needed transparency, aligns with our statutory oversight responsibilities, and gives staff a defined process to track financial and operational integrity during these sensitive transitions. My hope is that through this discussion, we can agree on both the necessity of greater oversight and the framework for implementing a consistent enforceable reporting mechanism for all receiverships involving licensees under the Commission's jurisdiction. Under Chapter 94G in Commission regulations, licensees remain responsible for compliance regardless of operational disruptions. The Commission must retain oversight over any individual or entity exercising operational or financial control, including receivers. Other regulated industries, banking, housing, insurance, have formal reporting expectations for receiverships. Cannabis should too. Proposed process. Implementation of a mandatory receiver disclosure and reporting form at the time of appointment. The form would be submitted alongside a copy of the court's appointment order and updated periodically, quarterly, for example. Data collection would cover receiver identification of authority, licensee under receivership, financial arrangements and compensation details, compliance and operational status, and disposition of reporting timeline. Other jurisdictions have authorized cannabis receiverships that emphasize regulatory notice, clear minimum standards for receivers, and active regulatory oversight throughout the process. Nevada, Michigan, Washington, Colorado, Missouri, and California have authorized cannabis receiverships with frameworks emphasizing regulatory notice, minimum standards for receivers, and active oversight. These states address federal bankruptcy limitations by integrating cannabis-specific rules into receivership processes, ensuring compliance with licensing and public safety mandates. So if I could pivot to the slides. Okay, let me just get them up on mine. Okay, so I'm going to walk through our current process, and I do have a couple of questions for I&E. And then I shared with my colleagues a proposed form for better transparency and oversight for these receiverships. In Massachusetts, receiverships for cannabis businesses are appointed by a court through a legal process, but are subject to specific regulations and approval by the Cannabis Control Commission. This state level process is a critical alternative to federal bankruptcy, which is unavailable to cannabis companies due to federal law. Next slide, please. So here are the steps for the appointment process. Initiation, a third party, typically a secured creditor, a business partner, or sometimes a business owner, files a complaint or petition with the Massachusetts Superior Court requesting the appointment of a receiver. Step 2, notice to the CCC. The licensee or person having direct or indirect control must provide notice to the Cannabis Control Commission at least 5 days before filing the court petition. If a third party files for the appointment, the licensee or person having direct or indirect control needs to notify the commission upon receipt of the notice that a petition was filed or threat of litigation was received in accordance with 935, 500, 104, 3C1. The court order. A judge following Massachusetts statutes and court rules determines if there is cause to appoint a receiver in case of loan defaults, financial distress, fraud, or partnership disputes. Next slide, please. Step 4, receiver vetting and approval. The court-appointed receiver is a neutral third party, but must still be vetted and approved by the court. The commission has promulgated regulations relating to qualifications of receivers seeking to become, quote, pre-approved court appointees. The regulations establish a pre-approval process through which the commission or its delegee may pre-approve, recommend, disqualify, or discipline a pre-approved court appointee accordance with 935, 500, 104, 3D2. Commission regulations identify certain qualifications it deems essential, quote, subject to the court's discretion, which are suitability, adherence to ownership and control limits in accordance with 500, 104, 3D1. Applicants not meeting these qualifications are subject to disqualification. Licensees are required to provide the court with notice that it is licensed by the commission, the qualifications identified in commission regulations, and the list of pre-approved court appointees. Step 5, timeline for application. The commission generally requires that MEs update the agency to any change or additions to the contents of any document to the commission within 5 business days after such change in accordance with 500, 104, 5. Next slide, please. How receiverships work. Once appointed by the court and approved by the CCC, the receiver takes control of the cannabis company's assets and operations, essentially stepping into the role of management like a board of directors or CEO. The primary goal is main objective is to stabilize the business, preserve the value of its assets, and maximize recovery for creditors. Operational control. The receiver manages day-to-day operations, including handling licenses, inventory, payroll, and ensuring ongoing compliance with all state and local cannabis regulations. They are subject to the same license caps and restrictions as other licensees. Some exceptions may apply depending on the court order or applicable waivers in accordance with 935, 500, 104E for license obligations, including the obligation to continue to comply with all legal and regulatory requirements except as otherwise determined pursuant to a court order or waiver. Next slide, please. How receiverships work continued. There's strategic decisions involved. The receiver evaluates the company's financial health, determines the best course of action, which could include a restructuring of the business, negotiating with creditors, selling the business or its assets, the license, the property, liquidating the company's assets to repay debts. A court order and CCC oversight. The receiver operates under the ongoing supervision of the court. Needing court approval for major actions like asset sales, they must work closely with the CCC to ensure regulatory compliance throughout the process, as the CCC has the authority to approve transfer of licenses. In essence, the receivership provides a structured court-supervised process for managing a distressed cannabis business within the unique constraints of Massachusetts and federal law, ensuring the business continues to operate legally while financial issues are addressed. Next slide, please. So currently, in the Massachusetts regulated industry, we have 24 licensees that have been placed into court-appointed receivership, 4 cultivators, 5 product manufacturers, 12 retailers, and 3 medical marijuana treatment centers. Next slide, please. So we'll pause here. I do have motion language, but I do have a couple of questions. Maybe Director Enos, I'm not sure if this is in your ballywick, but I'll just throw it out to you. So the slides, it says that the commission needs 5 days notice, for this petition to the court. So in essence, this court-appointed receiver has ownership and control, some form of ownership and control. And my question is, does the commission know with 100% certainty that any receiver of the 24 has not exceeded the 3 license cap of any license type? And I know I'm putting you on the spot a little, and I can direct it to the executive director, but do we know with 100% certainty no one has exceeded the cap?
So Director Koval is coming up as well, and so I'll just sort of get into, and I think we can confirm and double check for you, but ultimately, regarding the cap, once appointed, a receiver will be considered a person having direct control, and they would not be able to exceed the cap. You can have 3 clients, but not in the same license type, so they'd be held to the same cap under 94G Section 16. And so I think, unless there's somebody else who wants to definitively answer, my answer would be that I will take the look at that list that we went through and just confirm in certainty for you with regards to the motion that I think you're going to bring back at a future time, that would be answered at that time definitively.
Unless you can't answer with 100% certainty today, that exemplifies the need for something like this. If we were unsure or unclear that these receivers have not exceeded the license cap, but I'll go to the director, through the chair.
Please, thank you. Go ahead, Director Koval.
I just wanted to add that the issue is that a court can appoint a receiver, without letting us know. And so they do not vet, from my understanding, for suitability or for license caps. When licensing gets a notice and we add them to the license record, we will check for cap limits. But if for some reason we're not informed about a receivership, we wouldn't know. So we're definitely going to check out and double check on those 24, but I believe those are not over cap. But again, just keeping in mind that we do have the pre-approved court appointee process, but that's not mandatory. So it's not something that a receiver has to show to the court, like, look, because if they had gone through that process, then we would for sure vet for suitability and for license cap limitations.
Yeah,
Please, thank
do
you.
we have any? So there is an option to be a pre-approved receiver. Have we pre-approved anyone?
Yes, we have a handful, literally, not very many.
Okay. They've gone through basically the same due diligence as a licensee would go through, pretty much.
I mean, in terms of, obviously not documentation, like SOPs, but in terms of suitability, background checks, and cap limitations, yes.
Okay. And so once the receiver gets a court appointed and the commission is notified 5 days prior, are we hands off at that point? What happens?
My understanding, and I would defer to the legal team, but typically for receiverships, I mean, sometimes they will notify licensing, in which case we forward it to the legal team. Other times it goes directly to the legal team. They'll inform us. So I'm not sure, like, licensing doesn't do tracking in terms, it's not our lane really to communicate. Typically, somebody from the legal team will communicate with the receiver on behalf of the commission for any questions and, updates that we have.
And is this list public? This is a public list.
Someone already emailed me about this. Is it a public list?
I have a feeling we'll have some requests, and we'll answer that question. I believe at this point, the court documents would most likely be, and we would release that. And I think just to kind of.
But is it confidential? It sounds like it's gone through the court, so this is something that probably should be.
I would assume that the list will become public. Yep.
So do we have access to that?
I provided it to Commissioner Roy. I don't believe I provided it to all the commissioners. Certainly. So if I could just add as well, I think just wanted to highlight one of the points that Director Koval just made, which is we can double check the list. It is not required that the court go off of the pre-approved list, and the court may not have a part of their process that they're checking the cap. So I think it again speaks to Commissioner Roy's point on having processes in which we can confirm that, and the receivers should understand when going in front of the court and potentially taking on a client that they have to be living within those caps.
Thank you.
If I may, please, thank you.
Is there a way that we could How many pre-approved? We have a handful of
A
pre-approved.
handful, I can get that number.
We share that with all the superior courts, that list of pre-approved. Of
I don't
receivers?
believe that's something we've disseminated to the.
Okay,
courts.
and also I'm just in communication with the superior courts, that list as well as the cap limitations that exist that the courts might not be aware of.
Yeah, I could definitely coordinate with the legal team and see if that's something they can disseminate to the courts.
Okay, so what I'm hearing and what really compelled me to bring this is, not only the uptick, we have 24, these are distressed licensees. There's people's jobs on the line on a lot of these. And I'm hearing some less than desirable anecdotally things. One receiver, multi-hundred, $300,000 in fees. We don't ask them what their fees are. I'm hearing that, yeah, the receivers are getting paid and the law office they're working with getting paid, but then the distressed, there's nothing left at the end of the day. And these could be jobs and this, so what I'm looking for is, because I think this is going to be unfortunately a uptick in this trend, how can we get better visibility and transparency and oversight like the other states I listed on this? And I think this form, having a standardized form prescribed by the commission would do that so that no one is taken advantage of, that we have an understanding and an oversight of what's happening here, and that we communicate more proactively with the courts.
Mhm.
So I don't know if that sounds.
Yeah, and again, I would have to loop in legal again because I'm not sure, if we can ask for what fees or if, for example, the fee is too high, are we? Oh, thank you. If, for example, we find the fee inappropriate, is that something we can do anything about? So definitely I will follow up.
This is a little like secret shopper. This is the transparency will also, get people to be held accountable,
Mhm.
but also making sure that something like this is public, that
Right.
then people will be able to find this information. So that's-
Right.
Yeah, and this is just if I may, Madam Chair,
Please.
this is a draft. Obviously, we want legal to look at it. We want INE, we want many hands, commissioners to look at it. This was just to get something off the ground.
Mhm.
That you could bring, and I have motion language that I'm going to share. If we can move to the next slide, please, I'd appreciate that. That would give you time to digest this, make edits, get a legal opinion. And so I'm just hearing, it was almost like HCA's. We checked the box that you had one, and we didn't really have oversight until chapter 180. And a lot of unsavory things happen, unfortunately, because of the lack of oversight. And so my concern is we don't have enough visibility into what's happening here. And I think a form like this would allow us to have that.
Executive Director Ahern?
Thank you, Madam Chair. I agree with, and I think Commissioner Roy and I discussed a couple of potential tweaks to this just to kind of have some specifics to bring back. But I think for the most part, I think it is fair for us to be asking the questions of cost, those types of things. I'm not sure if there were a dispute between those two that we would play a role. It's probably between the licensee and the court, but ultimately us having oversight.
Facilitating anything like this?
I think that would be one of the items I think we should come back to with this information, with a little bit of research. I think as much as we can do, I guess to your question of should, I think the answer is, that's a discussion for the board certainly to have. I just want to make sure in certain instances, if we are unable to, it may be something between the licensee and the court, but ultimately, should we have access, I think, to the information Commissioner Roy is asking for at a minimum level, I think it would be a benefit to the licensees and the agency. And so I know there's a draft, but also I think obviously I'd be looking to help develop that between now and bring it back to the board.
Yeah, I just wanted to give us something to get us off the ground with this. I did have different motion language, or do we want to stay with this original motion? Is this the original motion language?
We did not update the slide. Obviously, this was presented previously.
Yeah.
My tweak, if you'd like me to add it, I can sort of.
Yeah, can you drop it in the group chat?
I'm
kinda
not in the meeting, so I don't know if I can.
But while you're doing that, in the meantime, I if it's okay, I'd like to
Please.
open it up. I see Director Koval, but my colleagues on the board, if they have any questions or thoughts or anything around this.
We'll let Director Cobalt.
I just wanted to quickly respond to your other question about how many pre-approved court appointees. We have 6 currently.
Mhm.
And just wanted to also, so when we say 24 licensees, 24 licenses, but some of them are held by the same
I
entity.
don't-
Yeah, so just for the record, thank you.
I'm in there.
Commissioner Stebbins, did you have?
Mr. Stebbins? Oh, sorry, I see his hand first, sorry.
Sure. I have a question.
Yeah, please, thank you, Commissioner.
Madam
Bennett.
Chair, which might be better answered by licensing, but my question is, of the 24, and I understand some of them are kind of lumped together, how many of them, do we know how many of them are using one of the 6 pre-approved receivers?
Off the top of my head, I know one is for sure. But we can look into that and get you that information.
That's a great question.
Yeah.
Commissioner Stebbins?
Thank you, Chair, and thanks to my colleague for putting this, asking for this to be on the agenda. Fully agree that there's the potential as we move through the maturity of this industry that we might see more of these. The court appointee process is an important step. It's provided for in our regs. A couple of things, obviously, not to be too picky, but I know we use the term receiver a lot, where we can adjust and make it court appointee, because that ties back to our regs, might be helpful. I'm also interested, and again, we might invite GC up or to the colleagues we already have up here, this pre-approved process. And we have 6 pre-approved. I'd be curious as to what information we ask from them. I'd be curious if we could ask them about, I think to your point, what's it going to cost? Maybe what their rate is. I mean, the more information we can get about folks that we pre-approve might be helpful to the process, give us a little more insight into kind of where the funds are going. Obviously, as we think about the bigger issue of accounts receivable, people getting paid back, I think is critical, but you know, just glancing through the form, I think there's some helpful information. I think there's, as I'm looking at, there's information we probably want to know up front, and then there's information that we probably want to collect as they go through the court appointee receiver process. But if I can ask the question, you know,
Please.
We've gone through court appointed approvals for 6. How could we entice more? I'd be happy. It'd be great to come back at another meeting and say, what information do we currently collect? What additional information could we ask? And, you know, I have to expect, I'm not a lawyer, Superior Court is probably not as familiar with our industry as even we are. Like, how are they making those assignments? Wouldn't it be better to have somebody who's pre-approved by us that they could say, obviously license caps aside, would be a better fit to help work this particular receivership case through a process? But I know that's more work in a bigger headwind, but
So, and I agree. I mean, this is, it's sort of a double-edged sword. One, we need to make sure that this is public so we can make sure that the businesses are in trouble because we're worried about jobs on one side, but this, I'm beating a dead horse here. But the other side of the point, we do know that accounts receivable is a significant issue. And while I think this should be public, you know, it also could hasten the continued slide of a business and undermine the, you know, the assets that are about to be transferred or sold. So, but again, because it is a public process, it's not something we can keep secret. When did we start pre-approving these court-appointed receivers? When and what was that process?
I don't believe I was here at the time. Oh, there you go, maybe.
I don't know the timeline. I'll have to get back to you on that. I would just point out it's 104(3)(d)(2) outlines the application process for pre-approved appointees, qualifications, credentials, affiliations, licensees, intended to be engaged, financial disclosures, licensees, good standing, limitations, suitability. So to Director Koval's earlier point, these are the folks who've gone through our suitability table. And so if I can clarify the earlier question as well, and I will try to get the timeline of kind of when that process was developed by the commission. Was the question from Commissioner Stebbins coming back on that timeline with how to encourage?
Is it in the regs?
Yes.
It is, okay.
Is the question, how do we, I'm sorry,
It said it's minimal.
how do we encourage more court appointees to go through the pre-approval process? Was that the question through the chair? I'm just trying to track for follow-up.
Commissioner,
And another question, so, when we had our CFAO give our presentation and we have to, we're statutory mandate to do these audits. And so it gets, now you got receivership, so this would help us in that vein on these financial audits that we're statutorily mandated to do
Yeah.
in these distress situations.
okay. All right. Any additional questions? I mean, how would you like to, obviously this is.
So if we go on the chat,
Yeah.
I've worked with the executive director on fine tuning motion language. It's a little different than what's up there. So if you would, I just want to make sure there's no.
Does the public get to see the chat? Or is it just
I don't know the answer
something
to that.
they could public records request? Because we share this, but it's not transparent to the people who are the 97 attendees who are watching this online.
My intent would be to read it into the record if we.
Yeah, no, but I'm just curious because, this is part of the record. This is part of our public record. How do people get this stuff? They can't, can they see? I don't know if they can they see this? No, they
No,
can't see this now. So this is
You need a
something.
certain link.
Okay. This
So we would read it live and then
Yeah.
obviously we would go.
It'll be on YouTube too, reading it live as well.
Okay.
Okay, so Madam Chair, may I?
Please.
Unless there's any other questions from colleagues or. Okay, so move to direct commission staff to develop a process for monitoring cannabis business receiverships under the commission's jurisdiction and bring this process proposal to the February 12th public meeting. This process shall include, but not be limited to, tracking the fees and expenses being charged by any court-appointed receiver to the licensee. The receiver shall be required to provide the commission with an initial written report at the beginning of the receivership and thereafter on a quarterly basis using a standard receiver reporting form prescribed by the commission. Each report shall include financial information and any material developments affecting the licensee's operations or ownership structure.
Commissioner Stebbins?
Thank you, Chair. Just a friendly amendment, wherever we use the word receiver, can we add our court appointee language? That's in
Yep.
our regs in front of it.
Are there any other questions? So I would entertain a motion with the suggested amendment by Commissioner Stebbins that where we have the word receiver, we have the language court appointed, making it consistent with our current regulations. So I would entertain a motion to approve. Commissioner Benedon, do I hear that motion?
So moved.
Do I hear a second? Commissioner Roy?
Second.
Having been moved and seconded, I will call the roll. Commissioner Benedon?
Aye.
Commissioner Roy?
Aye.
Commissioner Stebbins?
Aye.
Chair O'Brien votes aye. It passes unanimously. Thank you to.
Thank you.
Let me just.
Thank you, Director Caldwell, Director.
Thank you very much.
Thank you to my colleagues,
The,
Executive Director.
Hold on. Let me, all right, we can go to notices of deficiency and preliminary referrals. And Director Fern is going to be handling this. So
And
I'd just like to tee up, one of the reasons that we asked for these questions. One, I think it's important for all of us. And this is also part of, I think, the broader question that was raised by Commissioner Concepcion 2.5-3 years ago about the significant delegation of authority which the commissioners have given to staff. I know that she, at least at some point in time, was talking about looking at those 73, and I'm sure there are more now, in individual delegations of power that the commission have taken from their statutory authority and provided it to staff. So a lot of this is not transparent to us, the whole process. And as we know, for 2 years, we did not have a hearing officer, so that those 38 due process rights were a little bit disruptive. Now we actually do. It's my understanding we have 2 hearing officers right now that I hope that licensees are able to have an opportunity to work with. So that's a little bit of the broader process, understanding how does this happen. Again, it's not transparent to us as commissioners, not until it goes through this process. But also in speaking to Director Enos, one of the reasons that I initially suggested that we create the position that he sits in now regarding training is not just training our staff, our ID staff, our investigation staff, but it's also making sure that we train our licensees. And I'm a broken record, but I have mentioned Ralph Sacramone from the ABCC, who said that the Alcohol and Beverage Control Commission runs regular trainings for licensees, and within a short period of time after them beginning their monthly trainings, so that licensees can come and ask a question, and they were able to reduce their violations of their policies by 50%. Again, that was long ago conversation. So the bottom line is repeating what I think is very important. 1, making sure we all understand the process, but 2, Commissioner Roy and I would like to take a look at what some of these original NODs are, referrals, because it is important for us. As I know you are very busy, you're wearing many hats, Director Enos, but we would like to launch this with you or some of your direct reports to begin having those regular meetings. I know you have done this with independent testing labs, but being able to come and basically say, we know what these most common notices of deficiency are. And so if this is common, it means that it is being repeated across the industry. So how can we help licensees abide by the law? So anyway, I'll just tee that up, and maybe you can walk us through what is the process, what are the timelines, what are the due process rights that licensees have under this? And I guess I'm pointing at Director Enos, but I guess you're going to be doing that for us.
Thank you, Madam Chair. Director Enos can certainly get into process as well on questions. I just wanted to cover what you have in front of you and clarify. Are you looking for me to go through 3 and 4 together?
Understanding that you are stating, and again, you can refer to the memo that you sent to us, that you were not able to get us that information because it's too time intensive. So we'd hope to have it for this meeting to understand it so that we could begin the process of creating PowerPoints so we can start having these conversations with licensees. But it's my understanding that you weren't able to get this done. So if you could explain why we don't have that for this meeting, and then we can talk about the process.
Certainly. So there was 2 different information requests at 2 different public meetings in December. The first was for criminal referrals made by the agency to local, state, or federal organizations. That was at the December 4th meeting. The timeline for that is going back to inception. And so where we are right now, IT has joined to ensure that any referrals that may have been made by previous staff are also put in there so that we have a comprehensive list before we go about compiling that and putting it in a format for you. I would point out, as we have in here, and I know we've discussed in numerous different instances, the limitations of our IT infrastructure. So as you see here, the majority of these are in individual investigator files. So it has been a manual process to undertake. The next steps that I have here are to complete those last steps, which IT has been very gracious to move things around to try to accommodate and move this along for us. And then I will be looking to get this ideally in a format to you for the January 27th meeting. On the notices of deficiency, and again, I think to the chair's earlier point, questions on process, Director Enos can certainly get kind of more in the weeds on and explain any processes that are unclear. I think I probably stated earlier up to 25 violations could be an NOD. It can be more than 25 if I misstated that. And so what we have right now, again, a little bit adjustments that have been made in the past to try to keep NODs in one system, which is Dynamics. But ultimately, again, they are NODs are written files. They can include multiple violations. They can actually be for multiple licensees if somebody's vertically integrated and owns different license types. And so my understanding, and this is one of the things I think that we can clarify and discuss today so that we keep on track here, is that the intent is to put together educational materials that we can go out and provide to licensees so that they understand the most common violation within an NOD by license type. And so within that, I think a little bit direction as well as we get to the next stages of this particular information request would be is an overall grouping such as advertising. Does that meet the intent, or are you really looking to break down within that how you're getting hit for advertising? Because ultimately what we'll probably look to do with the help of the data team is employ the Copilot AI system to try to break apart these NODs. And so that ultimately comes down to how we prompt that to do it once everything is compiled. And so again, is kind of a grand category of advertising meeting the needs at this stage, or do we think that prompt should be probably more specific than that? So some of that direction will be helpful today. And again, if there's any process questions, obviously Director Enos can get into those. And I don't know if you don't mind, Madam Chair, if Director Enos, if anything I misstated, he might want to.
All I will say is that the whole, what I've heard from multiple licensees, and again, this is why you're in the role that you're in, is making sure that our team go in and obviously training and making sure that people who are new to the job understand. And the feedback I've got from licensees is you might get one investigator that said your camera's in the wrong location, but someone says it's in the right location. And they're minor, generally what I understand is minor infractions. But there have been complaints. And this is a rigorousness, and this is also the difference between wearing a badge and clipboard. Are we cops? Yeah, we are. But are we also, administrators and regulators who are trying to make sure that businesses can comply? I tend to lean towards the other side of the coin, and making sure that we work with businesses to make sure they clearly understand what their responsibilities are, because then it saves time for you folks to do the more important things, the public health and safety, making sure that the product is safe, making sure that we're getting things to consumers in a fair way. So this is not meant to be critical, because I know that you've lost a number of employees and you've been training a lot of new people, and they're all good people, but just making sure that we're partnering more closely with licensees to help them and answer questions for them. So this is the foundation of how we make this happen. It's making sure they know what it is, we know what it is, and maybe we need to be doing, some more to, put out information that people can understand. Thank you. Go ahead, Dr. Enos. Thank you.
No, thank you very much, Madam Chair. And thank you for giving me the opportunity to present before you today. Yes, absolutely. The NODs, obviously, when our staff is on site, we observe violations. Again, that is how we document and report them. But you're absolutely right. One of the other intentions of an NOD is to educate the licensees. Just to give a kind of quick overview again of how the NOD is structured, the citation is segregated to the left. That we have the regulatory language to the right. Under that, we will have the narrative for what ES observed or discovered that day. That information is obviously to bolster our observations for issuing the violation, but also to give licensees specific about it was a camera in the lower vault at this time. It was on this date. So we try to be as specific as we can in the NOD, obviously for our own reporting purposes, but obviously to give licensees the most information to fix it, because you're 100% right. We want them to fix it. The NOD is how we put them on notice. And again, just to go over the quick process, once the NOD is issued, licensees have 10 business days to then submit their written plan of correction. The written plan of correction has 3 pieces of information for every violation. It is, what are you going to do to fix it? How long is it going to take to complete that action? And what is the date you will be back into compliance with that violation? As the ED was mentioning earlier, one NOD could have 1 violation, they could have 30, they could have 40. So for each of those actual violations, they have to provide those 3 pieces of information in a written document within 10 business days. Our staff then reviews the written plan of correction and then notifies the licensee if the written plan is acceptable or not. If the written plan.
So can I just clarify?
Yes.
So someone goes in, how quickly after someone, maybe with a tip or somebody goes in, just on a regular investigation. So they have 10 days after that where the notice of deficiency is
No.
Just make sure I understand.
Yeah, so let me clarify. So for our staff, when we do our on-site inspections, we make all reasonable efforts to get an NOD drafted, reviewed, and issued to the licensee
You do
48
that
hours.
on-site.
No, this is after the
Oh,
fact.
okay.
So after the inspection occurs, we make all reasonable efforts to get the NOD drafted and issued to the licensee within 48 hours following the inspection. Once that is completed and issued out, the licensee then has 10 business days to give us their written plan of correction. I will state again, while we make every effort to get the 48 hours out, again, depending on the violations, depending on the nature of it, there might be other collaboration we need. Again, if we're citing 500, 170, we have to talk to another municipality. So there are times where we can't always adhere to the 48 hours because of other circumstances, but we make all reasonable efforts to get those NODs out as quickly as we can following the inspection.
If you see a public health and safety threat, that could compromise the health, especially of customers, does that take precedence over the cameras in the wrong place, or maybe the lock on the vault is not as secure as it needs to be? Do we prioritize health and safety potential violations?
Health and safety is paramount to everything. Health and safety is obviously for our staff, for licensees, the agent, and obviously the general public. So yes, obviously, if we see something for public health and safety, if we get a complaint, an inquiry, yes, we treat that with the utmost importance and we look into that like we would any other violation. Again, when our staff is on site, and that's another thing I want to bring up, we have to be open to everything. So even if we are going into an inspection with a particular objective in mind, our staff, and they do a great job about keeping their eyes open, because just because we're in there for one reason does not mean that there are going to be other things coming up. So our staff really does a phenomenal job, because there's a lot of areas where, again, licensees could find themselves committing a violation. Cameras are a very serious one. But no, for public health and safety, paramount importance. We treat all violations, obviously, very important, but yes, that is something we would certainly look into with great earnest and obviously right away.
Keep going through the process, and I may, we're going into executive session, so there may be a license, specific question that I might have. So I won't ask that now, and I will ask the question as to whether I've asked the question before I ask the question. So anyway, keep going. So they have within 10 days to come up with a plan of correction, but that can be extended if there are some complications or,
Yeah,
and
yes.
once you negotiate.
Yeah, so licensees again, so once we send that NOD, they have that 10-day plan of corrections. If licensees are having challenges with the plan, again, we would just ask them to communicate that with their lead investigator, and we would obviously have a sit down with them. Now, again, it's kind of hard to go through all of the possible reasons they can give us. Some might have more merit in stock than others, but there absolutely could be issues or times where the licensee might need an extra time, might need extra 5 days. We are willing to work with our licensees on that, because again, the idea is to get them back into compliance as quickly as they can. So if they need more time to understand something, if they need more time to confer with something in the objective, in the hopes that they are going to correct the violation as quickly as possible, we are more than willing to work with them on that. But assuming they do not reach out to us within that 10 business days, we are expecting that written plan. Now, one thing I just want to kind of state, just to emphasize, is the written plan does not mean that they have actually carried out physically on site what the plan is. So this is one thing I just kind of want to make clear, obviously, for everyone listening and for the industry. The written plan is what you will do. Once our staff is in receipt of that, we review that, and again, we accept the plan, or the plan can be rejected. If the plan is rejected, the licensee then has an additional 5 days to submit an amended plan of correction. That same process. If ES then confirms that this written plan is acceptable per the contents of it, again, depending on the violation, if it's a camera coverage issue, if my camera went down in my vault, corrective action, I've ordered a new one, it'll be here Monday, confirm that it's up and running by Tuesday. Those would be the 3 pieces we want. Our staff would then either through a on-site inspection the next time they're there, it could be done virtually. If it's a document, that could be sent to us to review. So it really kind of depends on the violation. But again, licensees, that written plan is just what they are stating they're going to do, how long is it going to take you, and when's it going to be complete.
If a health and safety threat serious health and safety threat is observed, reported, or a tip line, does that ever immediately elevate to the executive director level or to the chief level? I mean, obviously this is a lot of this is probably just routine stuff, and we were talking offline, and you were saying that advertising is obviously something that
Yes.
is a common issue, which
Yes.
is also one of the reasons the legislature is dealing with that issue, and something that we hope to address in regulation as well. But what happens if you see, a public health and safety threat, in the immediate, and we have seen this in the past. And sometimes these public health and safety threats have to be dealt with by OSHA or have to be dealt with by DPH. And we have seen this in the past where there have been some public health and safety threats that my sense is things should have been elevated more quickly. And sometimes things were not, I think, brought to perhaps even the commission level for us to be able to respond very quickly. And that's also, one of my questions is 30A is important for the licensee. That is their due process right. And we certainly need to make sure that licensees' due process rights are protected. And that's what you guys do. That's why we have this wall between what the commissioners can and can't do, can and can't hear. But also, we have seen some cases in the past, where there have been some serious public health and safety threats that probably should have been reported to the commission, or at least, have either an executive session, a conversation about it, because it probably exceeded the balancing rights, if you will, of the licensee's right to due process and the interests of public safety, but in particular for employees. So what happens in that instance? Because that's one of the, the conversations that I get concerned about. We always have this balancing interest, and I would tend to lean towards the public health and safety threat. And we have seen this happen in the past, and, but sometimes they're in conflict. So how do you guys deal with that?
No, thank you, Madam Chair. I'll kind of speak from more the inspection side of it. I don't want to speak behalf on another department. But obviously, in my experience, it's in my time here, again, what we have stressed to our staff is, again, reporting things to your manager kind of as quickly as you can. That's what we try to, again, instill in our staff. So obviously our staff is in the field numerous times a week. They are the ones, to your point, that might be seeing these things firsthand. Now, again, if it's coming through a complaint, if it's coming through another referral, there might be different pathways. But if this was something that our staff kind of caught wind of, if this is something our staff saw on site, and that would have a problem, this should be kind of sent directly up to their manager. Depending on the violation, again, this would be noted in a notice of deficiency. So again, that plan of correction that we are expecting to have and would review would have language in there containing the features that they're going to have to rectify the issue there. So I can't really speak fully to what happens kind of outside of that track. But the point I'm trying to make is that these are crucially important matters. I see the ED has his hands up.
Thank you, Madam Chair. And I don't want to get into specifics, obviously, but I think, since you and I have both been here, there's been at least one instance where obviously the team brought it up through the CIE of a serious nature, and the CIE generally will recommend to me that, please keep the commissioners updated on this, and I'll do that generally by
Because that has not happened in the past, and that's
prior to my prior, okay, yeah, no, I certainly it has happened since you and I have been here, and in that example, the CIE clearly stipulated or indicated to me, we're currently working on this, we'll continue to provide updates, but please keep the commissioners in the loop. Certainly we never want you to be blindsided by something in the media, those types of things, but ultimately your question is more about public health and safety, and so
but
when
it also is because on more than one occasion the media has gotten ahead of the process.
Right.
And we become aware of a public health and safety threat, and the process of addressing that public health and safety threat is not transparent to us. So this is actually an excellent exercise. I appreciate it. But I do think that it's good because I have been in this room where I found out from the press about a serious public health and safety threat, and I had no idea about this. And so it was something that probably should have been brought to the commissioners immediately. So Commissioner Roy?
Thank you, Chair, and thank you, Director. This is highly informative. I'm wondering that process you laid out, after inspection, usually within 48 hours, they get the notice of deficiency and the three criteria, how will you fix it? When will you fix it? So is that in an SOP anywhere that you can share? Is that written out process anywhere you can share with us?
Thank you, Commissioner Roy. We have internal SOPs for our staff where these processes are documented in. In terms of something, so is your question more like
bullets, like you could lay that out in bullets for us that I guess where I'm going with it, if I may, please, is as the chair opened with, we're hoping to put together a presentation to help us help the industry, help you help the industry type of thing. And so, and I like to give public presentations. I enjoy it. I've done it with older Americans. I don't always like sitting behind a desk, behind a computer screen all day. So part of this is and we've been asked. So let's, if we put together the most common notice of deficiency, and maybe I think you need to go a little granular.
Okay.
You do. And so on that, and then quantify it, like in the last year, there were 1,000 NODs or whatever it is. And we, as a jurisdiction, we don't.
800.
Is there? Do you know that?
About.
Oh, I was guessing 1,000. All right. It wasn't far off.
No. I would say the ED is correct. We're probably looking at approximately 800, 900.
And so, and Director, some jurisdictions actually assess a monetary penalty to their NODs, I've been told, and we don't do that. And I'm not advocating for that. But what I am saying is, let's take this as, this information that you're going to compile, we'll put it in a presentation, and, other commissioners can take it and go around with it too. Just, licensees want to know how to stay in compliance. And I think this is going to be enormously helpful. It's an educational tool that we can help. Like when I go through the post-provisional license inspections, and I do, it's like repeat thing over and over. It's on repeat, like no commercial grade lock. The scale wasn't calibrated right. I see the same thing over and over and over again. So if we're able to share that information and then help people avoid these pitfalls, I think it would save bandwidth on our investigators too. Imagine going into a place and everything is perfect and you don't have to go back and write reports and NODs. I mean, I think that's a win-win. So that's the goal here, is just so how can we take this information, synthesize it, and provide education? Thank you.
Great. If I could so we now have the 48 hour, 48 hours after, the within 10 days. So what happens after that? So there's an assessment. And again, I will stop asking questions because we've got to the heart of what I'm trying to get at here. So I will not,
Thank you, Madam Chair. Thank you, Commissioner Roy, for your comments. So once our staff has made a determination that the written plan of correction is acceptable, we will then notify the licensee via email that your plan has been accepted. So that again, that then comes back to the dates of implementation. So again, I'm trying to generally talk about it. It really depends on the violation. But if, let's say, the camera example again, the camera, for whatever reason, I ordered it today, delivery is not going to be for another 3 weeks for whatever reason. We would still accept the plan today, but our staff would know that that camera is not going to be on site for another 3 days. What we would then do is then during the next unannounced inspection, the next opportunity we have to be on site, that is one of the first items we will be checking to confirm the implementation of the plan of correction. So it's kind of like a two-pronged thing. It's really the written plan A, then have you implemented it on site. But again, kind of depending on the violation, there are at times where it might take the licensee some time to fix the problem. If it's especially something from a municipality they might need, it might take a week or two. But again, it's on the licensee to tell us when that timeline is going to be set. And the regs do state it has to be done in the most expeditious manner possible. So it can't be like, well, we'll do this 6 months later. No, the aim is to get back into compliance immediately. But again, to your earlier point, we will work with licensees if they have challenges on that. But
so what happens next? So say there's a minor, what happens next? So something's more serious. What are the options then? Something serious.
Can you give me more, Madam Chair? What do you, I'm just trying to think like an example. What do you, I'm trying to.
I don't want to be case specific, although there might not be licenses in the state anymore. Yeah. Okay, sorry, go ahead.
Sorry, I was going to talk next steps, not on process.
I just, again, if I can, and again, I probably derailed you more than I should. But I'm thinking like, you know what I'm talking about.
I think so.
Yeah, okay. Can I talk about that? I can't. They're not here anymore, right?
I mean, it was reported in the media.
All right. So someone dies, or there is a known environmental health issue, or we get a tip. I'm going to be meeting with Danny Carson and a group of workers who were inspired to come together, who want to help you make sure that we keep employees safe. And Danny Carson was one of the people who worked in Holyoke. And so we were not informed of a fatality for 8 months. And it's my understanding that, you know, that probably is something that should have risen to the level of the commission. So what would be the normal, you know, what would be the process? That's what I mean by a serious, you know, what are the due process rights? What do you do next if something is very serious? When maybe it's going to be a big fine. I don't know.
Thank you, Madam Chair. I think again, just to restate, all violations, obviously, we take seriously. All regulatory violations, we take seriously. Yes, absolutely.
Some don't go to the hearing officer, some don't, you know what I mean? And that's what I'm just saying. If you can, and maybe.
Madam Chair, may I?
Maybe it's just getting the process
May I?
right.
I think since what you referred to, the notifications have been better. So there have been other medical emergencies at licensees that have happened.
What I'm trying to find out is what's the process?
Well-
And maybe that's what you've asked for.
Well,
Maybe we can
and
get
we've
that
gotten
right.
notifications through the executive director. If there was a there's been significant
Right.
medical emergencies.
Right.
You know, not saying occupational, I'm just saying medical emergency that's
Right.
happened since that incident. So we have been notified. I would, you know, reinforce that if there is a medical emergency, significant medical, that the commissioners should be notified of that. I think that's important. And so, you know, I think the process is getting better since that incident happened.
I'm not questioning that. I'm really trying to figure out what happens. It's, I guess, the 30A process next. So we have the note, we tell them to do it, but it might be something, when I say serious, something that probably is going to result in potentially a fine. That's what I mean by serious, that we take everything seriously. Executive.
Thank you, Madam Chair. I think what
And you
you're,
can just send us the.
absolutely.
If you send us the written SOP, we can,
Certainly.
that's what I'm trying to figure out.
Mhm.
So.
Absolutely. I believe just for the public, because of the question, just to kind of connect it there, and this is actually in the annual report, it references internal referral. So generally speaking, when the investigative team is ready to go to the fine stage, you know, there's a process in which, depending on various situations, that it's going to enforcement counsel. So we can get you the whole process as part of this. I think what I would ask as next steps is if people feel comfortable, and on the point of kind of more granular, just advertising, that I'll kind of cover the categories with Commissioner Roy as we take the next steps of collating, and then aim, as I have in the memo here, to get this to the February 12th meeting with the other information requests for the meeting on the 27th. And if I can work with Commissioner Roy on those categories, I think that's kind of our next step.
I don't think we need it to be scientific. I think you probably have as good an opinion as anybody about what low hanging fruit, what it might be that we could help avoid potential NOD. So again, this doesn't have to be science. It has to be artful enough that we can put something in a presentation. We don't have to have every single thing quantified. We just want to have a general, and my guess is that some of your most junior, you know, newest, you know, investigators could probably give you their opinion, you know, so that would be acceptable in my opinion. Commissioner Stebbins?
Thank you, Chair. Thanks for bringing up this topic. A couple of points and then probably one more question for Director Enos. Because it all does relate to training. I have always loved the approach of your team and your colleagues of bringing people back into compliance. I think to Commissioner Roy's point, it's not always meant to be a heavy hand. We don't get to keep penalties and fines anyway, so there's really no reason for us to be heavy-handed about that. And Director Enos and I think back, Chair, to your point about the ABCC opportunities, we did have a chance to go to one of those ABCC presentations. And it's truly helpful. Kind of just tying into all this, you know, I think we've all been to licensees and we get the question, why do so many people show up? And I was at a licensee and inadvertently, an hour after I showed up.
It was noted on social media, so,
Yeah.
so.
And inadvertently, a surprise inspection happened about an hour after I got there. But, you know, the explanation I've always given to a licensee is we're training new people. The best place to do that, I think, Chair, is to have the junior people follow the senior people around. Also tying in another explanation, which I think either Armin, you shared with me or Chief Jones shared with me, which is more people on site, the quicker, hopefully you can get through the investigation and tie up our licensees and their agents, hopefully less time if you're kind of splitting up responsibilities. So I find that helpful. You know, we've had conversations here, and I think this does tie back to your point, Chair, of the value of RVT and the 4 hours every year that people are spending rehashing how a bill becomes a law. I would like us to think, kind of expanding beyond what you're envisioning, expand beyond that to what training materials can we produce that every agent can see? You know, just as, these ABCC events are great. You usually get the owner, you get the general manager. You may not get the store clerk. So kind of doing both kind of puts everybody on notice. And when we think about our referral line and tip line of something coming in, if I'm an agent and I see something that maybe my boss is not following because I've watched Armin Enos videotape, am I a better informed agent in using maybe RVT time to?
I could see him becoming a TikTok star.
He's got a face for television and radio. Again, not to put anything more on his plate. And again, always caution when we're brainstorming, and the only place we can do it in open meeting doesn't mean our staff start scurrying tomorrow morning. But just to, you and I building out RVT in a bigger, more helpful way to, hey, this is the NOD that we're seeing. It's more prevalent. Here are the things that we look for. So it kind of just expands everybody's awareness and of potential violations.
I mean, unless do you have an additional? Because I'm just saying, I'm happy to get the process, because I'm looking at just in the interest of time, but also understanding the time frame. If you have something that saves me the time from reading, and there may be some additional policies that are layered over, if we can just see what that is. Obviously you've given us dates and times within 10 days and 48 hours. If you have that from stem to stern, from the most minimal NODs, and then walk us through, because again, we didn't have for 2 years, we didn't have the hearing officers. So it's I've never seen this. And so I would like to get a better granular understanding of how long do we have, what do we do, and also the training will help us, I think, do a better job to help licensees, do a better job to help you focus on the really serious things, but also make sure that we understand that process, again, because we didn't have that robust 30A. We were not necessarily allowing our licensees a full 30A due process rights. Now that we actually have this in place, if I could see that in one place, that would help me. So I don't have any other questions. And Commissioner Roy, anybody else?
I just have a comment, and thank you, Director Enos. And the goal is, how do we get these 800 NODs to 0, right? And I'm not saying that's, reality, but the goal is, how do we get these 800 NODs maybe to 400 next year? And I think this could play a major role in that. And also, if we get this up and built, and any commissioner could go out and give it, you could go, any one of us could do it. And, if we get this up and running, by the time social consumption launches, that's going to take up so much bandwidth. If we get everybody else on a super duper compliance training here, social consumption is a ginormous thing we're going to all have to tackle. And so it'll take a lot of bandwidth. So if we can free up space here, that can let us focus here a little bit more. So just some thoughts.
Thank you. I don't have any commissioners have any further comments and questions, and I apologize if I took you off track and took longer than it needed, but thank you very much.
Thank you, Madam Chair. Thank you for the board. Thank you.
Thanks very much. And we got to think about that TikTok thing. We're going to work on it. So I can see it. Michelle. What's his name? Headroom. I said. Okay, we're going on to notices of deficiency. Oh, no, we're going on to delegation of powers to approve licensees. And this should be a fairly quick session if the general counsel can come on up. This is one of the questions that I had in watching in absentia for a while. And I want to make sure, again, in coming back, I think that I've been very clear that we have statutory requirements for a lot of different things that I want to make sure that we are following. On a number of occasions, and not a lot, but we only had 3 commissioners who were serving, 3 out of 5. So everything had to be done by 3 people. On occasion, maybe someone was sick, or maybe, or there was a recusal. So it's my understanding what the policy is that they would delegate authority to the executive director to take a vote. And I just have the question, and this may be something that you have to do some research and come back to us, so you may know this. If you can't vote on a license, how do you vote to delegate that authority? I don't know if we can, and if we can't, we might have to go back and this was one of the first things that I did when I came back is I believe that we had a number of process issues that were not fully met under the quorum and under the statute and under how the commission should be organized. This is a sort of de minimis question, but frankly, it also has an impact on what's going to be happening if indeed the legislature moves from 5 to 3. Quorum, it basically will mean that no 2 commissioners will be able to talk about policy outside of open meeting. In addition to the additional workload, but that's a different thing. But if you only have 3 commissioners and the quorum is 2, and maybe somebody's sick that day, this conversation may color what ultimately happens with the new legislation. So can a commissioner who has to recuse themselves on an issue then vote to basically say, I can't vote on the license, but you do it? How does what is the legal underpinning for that? And I don't know if you know that, Commissioner Ben and Don.
I don't know off the top of my head.
Okay.
I have a sense, but it's not based on legal research.
Okay.
So,
All right. But can you explain the how if we don't have a quorum, how we make up a quorum by voting to make that quorum extend our sole statutory authority to do certain things? How do we, on a temporary basis, delegate that to staff if you can't vote on the underlying?
Thank you, Madam Chair. And thank you for that context. That is not context that had been provided previously to me. And I think just to level set for people that are watching and for people in the public that might be here in the room right now, historically, the process at the commission prior to your reinstatement, Chair, was that the agendas for meetings would be set 2 weeks in advance, and materials would be provided for those meetings, 2 weeks in advance, so that staff could research and be ready and be prepared to present and have a meaningful discussion on items. Since you've returned, Chair, that seems not to have been the process anymore. So. So I with this item in particular, this was a later add within that 2 week window. I was not given this context.
You've been asked for this opinion in the past, though, so you
I
must have
was,
some legal underpinning for those.
well, what I can tell you, Chair, is, and I'll have to look, now that I understand the question that you're posing, I can take that back and provide a more meaningful response at a future meeting. But as you mentioned, this has happened in very rare circumstances. If I can just
Okay, right.
try to finish what I'm saying here. This has come up really in a handful or less of situations where there has been an insufficient quorum, an insufficient number of commissioners to vote on a matter due to a recusal. And this happened when we had 3 commissioners, one of them had to recuse for whatever reason, 2 were left. And, in those circumstances, given what you had discussed earlier today about the consequences of a failure to vote on those matters. So as discussed earlier, oftentimes renewals will come up, the licensee is set to expire or is within days of expiring. And if action is not taken, then the license will expire and they'll have to shut down. And in those circumstances, the situation was presented to legal, and in those circumstances, legal had permitted that delegation under an exigent circumstance kind of scenario where we didn't want to have the business close.
I think you're restating it, but so this is an exigent circumstance issue. This is what I'm saying. When you were asked for your opinion previously,
Yes.
did you have any legal research done? Because it's my understanding that you provided those opinions. So have you done that research to ensure that it is, because I don't know, anyway, if you can't answer it today, I guess I thought you had been asked for your opinion previously and that you stated it was legal. And this is also part of what I raised originally when I did return, is that I conjectured that we were not properly authorized under a legally designated chair. It's why I wanted us to take 3 votes to just make sure that we were, dotting all the i's and crossing all the t's when we were properly organized. So if you could go back and maybe see the notes and the research that you did before, because it's my understanding that you offered an opinion. So if you could just get us whatever legal research you did to offer that opinion, if you could get that to us before the next meeting, that would be great. So we can, Commissioner Roy?
Yeah, I think we do need a robust legal opinion, because my concern is that under 26(8)(a), it was me who always asked, am I able to do this? And my understanding, a commissioner recuses from a license matter cannot delegate their own vote or adjudicatory role on a specific license to a staff member once recused. So I'm wondering if the board, we would establish rules of necessity.
Mm-hmm.
And if we establish rules of necessity, in other words, if we don't have quorum to move a matter, if we had established rules of necessity that would, so that person wouldn't vote that day on delegating to the executive director, that would automatically happen through rules of necessity, because technically I probably should not have even delegated my authority to the executive director, because once you're recused, and I probably should have stepped out of the room, you're recused. So in hindsight, and I did ask for a legal opinion, so I'm thinking maybe legal can come back with what would look like a rules of necessity. In other words, it would automatically happen to the executive director if we have 3.
Meaning like in the charter. Although this was important too.
Yeah, or we could vote on a standing.
This was one of the agreements that we had in the charter, was that when in the hit by the bus scenario, that the executive director did not either have a standing delegation or not have the opportunity to delegate authority, right? And so we had an agreement, I think you recall this, that we had an agreement in the charter, it wasn't voted on yet, that the secretary would be the acting chair. Again, that did not happen. And so, and it had not been voted upon. So, there's some there. But I just want to make sure that at all times we have sound legal underpinning. It's why we were, I think, pushing so hard, all of us yesterday, on the Donahue report, because I think we all want to make sure that whatever we're doing, a sound grounding in statute and regulation. So Executive Director Ahern.
Thank you, Madam Chair. I would sort of echo where I think Commissioner Roy is going. I think, we certainly have had a couple instances, especially during the period of time, obviously very limited, but when we operated for quite a while with 3 commissioners since I've been here, where this had to happen. And I know additionally there had been instances prior to my arrival as well, and prior to the current general counsel. So I do think coming back with a full opinion would be great. I also think having this in place is very obviously necessary, because I think, as we heard earlier, and I think the general counsel just aptly brought up, there are instances where we have to act nimbly on behalf of the licensee, and that is the intent of the board, to try to accommodate the licensee, and so we need to have those tools in place.
And I will note that I think one of the state senators, when they were looking at legislation going through, and I think in especially smaller communities, there's sometimes an accessory, commissioner, board member, selectman, whatever, when they have quorum, alternate, whatever. But anyway, but I just want to make sure that we are tying things up legally, and if we didn't have a legal opinion previously written, if we should get one now. Commissioner Roy?
Yeah, I mean, again, with 26(8)(a), recusal removes the official from the matter entirely. It's not a transfer of authority to a surrogate, but a disqualification from acting at all on that case. Allowing a commissioner to hand their vote to staff would defeat the purpose of the recusal, because the conflicted official would be still effectively influencing the outcome through a designee, which runs counter to Massachusetts ethics guidance and impartial decision-making. Now, this happened to me. This is real. So I was recused. I asked for opinion. Yes, you can delegate. And through the grapevine, I heard it. Why did she even do that? How did she have the authority to do that when she was recused? So this is a real scenario that happened.
So, Director Ahern, and I think one more point, and then
I was just going to ask if you could kind of give that information of where that's coming from, so we can include that in the opinion. Just where you were reading from the issue. Okay.
Was it 26(8)(a)? Yeah. I'll send it. Okay. Right. General Counsel.
Yes, thank you. Actually, the ED just asked my question, so I'm happy to prepare that opinion and incorporate whatever materials that Commissioner Roy just referenced.
Excellent, thank you. Sorry.
One point to note as we're looking into this issue is that it might help to look into whether there's a distinction between delegating your vote as to a specific licensee. So say this renewal is coming up in the next month and I can't vote on it, so I'm delegating you for this, as opposed to adopting a policy that more broadly states in advance, anytime there is a lack of 3 voting members, then authority has been delegated. So that would be kind of a vote once and then anytime going forward, because that might have a different answer. The language that you just read, where you can't say, I can't vote on this license, so you vote for me, seems a lot more problematic than saying,
doing that.
Right, than saying as a policy, if I can't vote and therefore we lack the quorum, then we already decided 6 months ago.
Yeah, and that's the rules of necessity. That's the rules of necessity, so that we would have already in place.
And so, but those 2 situations might have very different answers. One might be acceptable.
I agree.
So,
all right, thank you. So the next thing that we will, and I think you are still, this is the update on the motion to intervene.
Thank you, Madam Chair. To the extent that you're looking to discuss a particular case, I think you are, I think I would suggest that this be done in executive session.
Okay, all right, thank you. All right, I think so. Thank you. I think next up, CTIO will come up and help us with the de-anonymization of raw testing data. But and Stephen Ledzinski, Attorney Ledzinski will come up as well.
I just want to point out for the record that Mr. Ledzinski does not speak on behalf of the legal department, so I'm not sure what purpose he has in coming up, but he'd be speaking from his own personal capacity.
Thanks.
Okay, Madam Chair, please. Wouldn't he be speaking as the 76I,
Yes.
not in his own personal
No,
capacity?
he's speaking under
As a
my
designee?
authority as 76I is the staff person I've identified to.
I do understand that an opinion on 76I has been rendered,
No, it says not.
and that does not support the designation.
No, it's actually not. It's not a final document, and we've just had a recent meeting, talking with the outside attorney. So we'll be final soon. I'm hoping that it'll be done within the next 2 weeks. So just very quickly, this is just to kind of button up, the issue about the anonymization of raw testing data. We went back and forth about whether or not, and this is just a quick question. Okay, I want to make sure that we are doing this. One of the issues was raised that we needed to get waivers from independent testing labs. And I think that we have the authority to do that. And I think that we have the ability to do that. And this is one of the things we went back and forth, but I just want to make sure that we are making this happen. So technically you can do this. Yes.
Chair, thank you. Yes, we can provide the testing data either de-identified or identified. It does not have a significant material impact on the ability to meet our deadline, as we talked about in end of February, early March.
Okay. And we've already voted on this. Yes, we voted on this. Yes.
Sorry, Madam Chair, at
Yeah.
the December 11th meeting, we voted on COAs. So COAs are the same March 2026 timeline. That was the metric person that we brought in. That will go on the product catalog. The raw testing data would go on our website with our open data platform. And the data team is prepared to have that ready for March. So the question is anonymized versus de-anonymized. And we did not complete that discussion on the 11th.
Okay.
We voted in COAs.
Today then? We
If-
take a vote today?
If the desire of the,
Right. Yes. Yeah.
if the desire of the board is to de-anonymize, I would be looking for a vote, yes.
Okay. Commissioner Sevens?
Thank you, Chair. I want to make sure I'm on the right page when we're talking about the raw testing data. That is specifically aligned with our ethics of using large laboratory test results as we find it on our website.
Can you restate that question?
It's really the train is going back to
Yeah.
it's loud.
Yeah, sorry. Obviously, we have testing data results right now are anonymized.
Correct.
And I just want to make sure it ties to what we have put on the website is our ethics of using that large laboratory test result data sets. Those are aligned. Like the ethics of the usage ties to the data that we make available.
I'm not sure I understand the
I think
question. Yeah.
that the question was whether or not we have to request ITLs to allow us to do this. And in the last conversation, we pointed to the fact that we have done this before. Commissioner Roy pulled out and some sort of a report that said, yes, we've done it before. And then the counter opinion from the legal team was that, well, that was only during COVID, and so it was an emergency. And I believe that we actually have the ability to do it outside of a COVID disaster. But I also think that it's the right thing to do. I don't think that we should be asking testing labs if they're okay.
Permission.
That they share that with us. So anyway, I just quick thought that I've been talking to Attorney Ladzinski because I have been working, diligently to make sure that we get as much information about potential testing fraud. We will be talking to, we've talked to the ITLs. The ITLs have told us it's a problem. The ITLs have told us that they want to be held accountable. And so I think that this is just one tool that helps us hold them accountable, but it's also a tool that helps consumers protect themselves. And so I had asked the question at that meeting, and the answer that I got was, we probably shouldn't do it because we're worried about liability. And I'm saying, I don't think we have a liability issue. I think that we have a public safety issue. So just quickly, I think that you had Just, if you could just walk through that, Attorney Ladzinski. And then if we'd like to have a countervailing argument, I'm happy to have that. But this is really important to me, and I just want to make sure that we're getting both sides of the issue, so.
All right, thank you, and Happy New Year. And there were questions that were raised since last year, a few meetings ago internally. They've also been raised externally. And all I'm going to do is just, for purpose of clarity, just point to the statute and the regs, because that's where we find the authority. So there's really, this involves, what is on metric and what we can request that be put on metric. And so both the statute and the regs, it's a combination of, they address a combination of testing and seed-to-sale tracking issues. So under 94G, Section 4, everyone knows we have the powers to carry out administration and enforcement. And under 4A.5, we have the power to adopt regulations. Now, for seed-to-sale tracking, under little Roman numeral 17, it does in 94G.A.5, it does state that we can adopt minimum standards that all licensees possess and operate an interface seed-to-sale tracking system sufficient to ensure the appropriate track and trace. And under Roman numeral 20, again, it says that our requirements and standards have to leverage seed-to-sale tracking technology. Now, with regards to testing, the statute under 94G Section 4A.5 also says that health and safety standards, we have the authority to test and to maintain health and safety standards. Under 26 little I, it also states that requirements for labeling of a package containing marijuana products shall at a minimum include results of sampling, testing, and analysis conducted by a licensed ITL. Now, under the statute in Section 15A, 94G, under subsection 1, it states the commission shall promulgate regulations for the licensure and oversight of independent testing laboratories and shall establish testing protocols for the sampling, testing, and analysis of marijuana, finished marijuana, and marijuana products. Now, let's go to the regs, because the statute sends us to the regs. So with regards to
Could you please reread 26 little I, 26I?
26 little I is,
What section is that?
Roman numeral 26 little I.
Is
So
it the
under-
statute, Stephen?
Yeah, it's a statute.
Okay.
It's 94G Section 4A.5. The commission's regulatory authority also includes, and I'm just reading the relevant section, the requirements for labeling of a package containing marijuana products that shall at a minimum include subsection 4, the results of sampling, testing, and analysis conducted by a licensed ITL. Now, I also mentioned 94G 15A, which talks about the testing protocols. Then we go to the regulations. So under our regulations, with regards to seed-to-sale tracking, we go to the definitions. And, the definitions, there's a definition for seed-to-sale electronic tracking system, a system designated by the commission as a system of record, and it shall capture everything that happens to an individual marijuana plant from seed and cultivation. It goes on to say any secondary system used by the marijuana establishment or an MTC or an independent testing lab shall integrate in a form and manner determined by the commission. Now, under the definition, seed-to-sale system of record also talks about the electronic tracking system designated by the commission. Now, the regulations under 500-105-AD also require that the marijuana establishments shall attach plant tags using a seed-to-sale methodology in a form and manner to be approved by the commission. And under 108G of 935, 500, again, it says that products, marijuana products shall be tracked in the seed to sale in a form and manner determined by the commission. Now, with regards to testing, under 500-160 sub 1, it says that testing of marijuana products shall be performed by an independent testing lab in compliance with a protocol established in accordance with 94G section 15, which I just read, and in a form and manner determined by the commission, including but not limited to the protocol for sampling and analysis of finished marijuana products for MEs, MTCs, and co-located operations. Now, with regards to the protocol is there, but like I just read, the regs under the direction of the statute clearly state that in a form and manner determined by the commission, including but not limited to the protocol. Now, we had this issue a year ago where we were being challenged as to our authority to require certificates of analysis be put on metric. And, we saw that the authority was clearly there. The administrative order was actually issued. It was issued on April 17, 2025, effective June 16, 2025, under which, we require licensees to upload certificates of analysis and metric. So, 160 sub 1, 500, 160 sub 1, and 501, 160 sub 1, they do authorize the commission to determine the form and manner, including but not limited to the testing protocol. So an administrative order is one tool that we have and it's clearly authorized under the regs, under even the language of the statute, which says that we are authorized to issue regs. The regs clearly state, including to the testing protocol, but not limited to. And we have actually utilized these sections to authorize administrative orders, which is one of the tools that we have to make these requests. So, it's been done before recently, and I was just reading the law and the regs. So
Thank you.
I wanted to clarify that because there's been not only internal questions, but also externally, we've had questions before.
Commissioner Roy.
In 94G, section 4, Romanet 8. Commission may prepare, publish, and distribute with or without charge, as the commission may determine, such studies, reports, bulletins, and other materials as the commission considers appropriate. Prepare, publish, and distribute with or without charge, as the commission may determine, such studies, reports, bulletins, and other materials as the commission considers appropriate. That's 94G section 4, Romanet 8. Thank you.
Director Ahern.
Thank you, Madam Chair. I have general thoughts of kind of everything that we're doing, which is obviously the mission that we have here and the goal of expanding the open data platform. And I think we're all on the same page. Obviously, we're down to one last question here, which is launching a lot of information in March 26, consumer-facing COAs, and then the aggregate data, which is this question. I understand all of the points, and to the earlier point, I would be looking for a vote if you would like us to de-anonymize in March of 26. My point is more, can the information, when we put it in the aggregate form that's being requested and that we'll be doing in March, is there proprietary information in there that an ITL would have an issue with, that we release it without us having that discussion? And I think a waiver is an elegant solution to that to achieve the goal. That is really the issue, not can you do it. If you vote for us to do it, as the CTIO said, that can be done. It's going to be up in March of 26. The question is anonymized versus de-anonymized. If the aggregate data contains proprietary information and an ITL does not feel that we should have done that, that is ultimately what's being brought to you to consider. Again, I'm not questioning whether or not you can direct that de-anonymize process.
And again, the proprietary data, that the example that was raised was client lists. And ultimately, that is not what's being put up here. We're not client lists. We're talking data, public health data that consumers can see, that researchers can see. There is no client data. And as a matter of fact, I'm wondering if we can create something, if there's a way to, if the concern is client data rather than public health, if there might be language that precludes us from releasing client data. We can do that, right?
Madam Chair, if you could clarify, I'm happy to
Well,
try
I
to find a solution
understand
here.
the client data thing in the first place, but what I'm saying is we would not release client data. So we have de-anonymization of the raw testing data, but we will not release client data.
Okay, if I may, Madam Chair.
Please, thank you.
So I think one thing I would sort of note, because Attorney Ladazinski referred to administrative orders, right? And that administrative order, I believe was number 5, basically stipulated that the businesses would make those COAs. Well, the businesses must make the COAs available. We had stipulated that they must include whether or not there was anything done to the product to sanitize. So, I think in that regard, it is their responsibility to have the COA available. What we're doing going into March is to have the COA available on our platform, which was the recommendation from myself in December to have that also have a waiver. In this instance, the issue is what can be ascertained by having all of this is a very large data set, obviously, and that's why I think we talked about having it on a quarterly basis. There will be a substantial amount of work being done by the data team to accomplish this. I agree with the goal of having the information available, and just simply the question of if you list the ITL, then you will be able to ascertain by having that data set their client list. And then, there's other things as well that you can ascertain by having the aggregate data. That's it. It's the things that fall within not only state statute, but also our regs that stipulate there are areas of information that even though it is kept on metric, once you put it out in a certain form, it could be considered proprietary. That's the only concern.
But and again, we had a robust conversation, but I've heard nothing. And we actually asked, what are other states doing? And it's my understanding that the Connecticut
has 2 labs.
Connecticut, oh, well.
So
But
if I
again,
may,
we have a lab testing problem. We have had to suspend the license of one lab, one ITL. So I don't know why the pushback it's stunning to me what this pushback is about, because I don't see the client data reach here. And frankly, I think that this is just public safety. Commissioner Roy?
And so administrative order number 5 was not a may, it's a shall. Like they have to upload their COAs. And going back to statute 94G, section 4, Romanet 26, requirements for the labeling of a package containing marijuana or marijuana products shall at a minimum include, and I'll just jump to number 4, the results of sampling, testing, and analysis conducted by the licensed independent testing laboratory. So it's out there. We're having these QR codes on these products in social consumption, and we have these COAs that are they shall upload them for every test. And so this is a matter of protecting the public and providing this information. And that's where I feel the exposure is most significant, that we haven't done enough to do that.
Right, Executive Director.
thank you, Madam Chair. No, and
I just don't understand this pushback.
thank you.
Because we've had a month now and I haven't been given, and no one has provided me with any cogent legal argument since the month that we raised this issue, right? I haven't heard that. No one has presented that to me. This was on the agenda. And so make the last point, but I really think that we can, and if people don't agree and they don't want that to be transparent to consumers, that's fine. But I think we should just take the vote, move forward. But I want to vote for the maximum transparency. We know that there are significant testing issues that we are looking at right now. We have already seen one lab suspended, and we have seen, and we already have demonstrated that we are trying to not provide fulsome language about what this problem is to the public, to the legislature. And so that's why I think this is especially important. So I don't know why the push, I don't get it.
And Madam Chair, I want to clarify, the pushback is on one particular item in a very large data set that will be ready to go in March of 26. I think the public health and safety component of this, as Commissioner Roy mentioned on the COAs, is the consumer approach to this, and this is the Connecticut model, is the COA, right? That's where you're looking at the product, you're seeing what's in the product. And the Connecticut website allows for the COAs, which is what we're doing in March of 26, and we discussed in December. It does not have aggregate data. We talked to Connecticut and they confirmed that that is not something that they provide. So ultimately, all I'm saying
is they're just not providing aggregate data.
They're not providing the aggregate data. Yep. And so in that instance, and again, to Commissioner Roy's point, where they only have 2 ITLs, it's not an issue of proprietary data because there is no concern of who has information on what other ITL. And ultimately, from a public health and safety standpoint, the idea is the information is out there. It is us, to your point earlier, on the action we took against an ITL, where we have access, obviously, to the name of the ITL, but putting it on our website. And I think as well, the work
team did not have access to this full internal data that we were collecting. And so again, if people want to vote against it, they can vote against it. I don't want to, I'm not going to die on this hill, but I think that it's important enough. I haven't been given any sort of cogent, we had a robust conversation the last time, and I have not gotten anything back. And I had explained to you, we're going to put this on there. It's been on there. I haven't gotten anything. So, and Commissioner Bennett, you're raising your hand, but, I think that you should either do it or not do it. And if we don't have 3 votes, we don't have 3 votes. We'll just move on. Okay. Commissioner Bennett on it.
Sure. So I think one thing I want to point out as a general approach is that first we heard from our general counsel in December, and we've heard from our associate general counsel now. And it doesn't strike me that what they're saying are necessarily in conflict with each other. Mm-hmm. The role of an attorney, I've been an attorney for over 20 years, and it's to advise on potential legal risk, but then it's up to us as the board to decide how much of that risk we are willing to take on. And so I personally don't think that we've gotten incomplete or inaccurate recommendations from either of our attorneys, our very capable attorneys that we've heard from. We might be getting a more conservative approach or recommendation out of one, but I think I just want to put it out there that no attorney out there can predict with certainty what our exposure or what our risk is. They're putting, both of them, I think, have ably put all of the facts and analysis out to us, pointed out relevant provisions. There might be disagreement on which provisions are relevant, but to your point, that ultimately we have to decide as a board if we think this is a risk. And I do personally think there is some risk and some exposure, but do we think that this is something that is worth it in the interest of public health and safety and transparency? And that's something for us to weigh. And so I do feel like legal counsel has been put maybe too much in the middle of this when ultimately they have ably given us recommendations, and it's really on us now.
Right. But I will say that I have asked in public meeting questions about exposure, and I was given 1/2 of the answer about exposure on one issue about making data public. And then when I asked the question about potential exposure, because there have been rumblings of class action lawsuits that could be filed against the commission for failing to do its job. So I have not, I asked for that information. It's been over a month since we've had that conversation. I asked for that other side. And again, there are reasoned points on both sides, but I have not been given information, on the other end of things that when I have asked the question, do we have potential exposure from class action lawsuits on behalf of consumers because they do not think that the commission has been nimble or aggressive enough in going after testing fraud, which we have one piece of evidence that probably we suspended a license because we made that allegation. So I wish that I had gotten a more fulsome response to that end of the argument. And so we have 2 competing, interests. One, I hear we're worried about liability based on a lawsuit between independent testing labs, which we're not a party to. And then, we have other potential liability that we could directly have. So I wish that I'd gotten some memo that said, no, we don't have any liability in terms of a potential class action lawsuit, but Attorney Lizinski.
Thank you. So I basically only read statute and regs. And I just want to read the short first paragraph of the Administrative Order number 5, which states the Cannabis Control Commission, acting through Executive Director, hereby issues Administrative Order number 5 to ensure transparent and consistent reporting of compliance test results for marijuana and marijuana products sold or otherwise marketed to patients and consumers, consistent with the statutory mandate under GL 94G and 94I and applicable regs under 500 and 501.
Thank you. All right, Commissioner Stebbins.
Thank you, Chair, and thanks to our AGC trying to keep up with you as you went through all the statutes.
That's a lot of minutes.
Just for clarity, I want to make sure I'm in the right space. When you go to our website, we're looking at test results for THC percentage and THCA.
On the open data product catalog, that, yes.
Okay, so when you open that up, it's obviously a lot of
It's essentially a spreadsheet.
anonymized information.
Correct.
Right, and attached to that, we have a data dictionary and user guide, which is kind of what I was getting to before, which talks about the ethics of using all that large testing database. And there is a complete focus in that section about the anonymity of that information, being that it really is intended to be for research purposes, not for the person who's going into a dispensary to buy something off the shelf. We're, again, completely agree, I think, with my colleagues on the importance of that COA.
Yeah, so thank you, Chair.
Please, thank you.
So thank you. And I want to try to, yes, you're absolutely right. I'm going to state again for clarity, the difference. The product data catalog, the raw data that we're talking about in this moment is large bulk data, millions and millions of records in question here. The intended audience really is research, enforcement, those type of activities is an aggregate. The COA, which is the individual product, is the consumer side. And when we spoke with Connecticut, that's exactly what they stated is they do is they see the COA, and this is, other jurisdictions I've spoken with, the COA is the consumer facing, and that's where the public health and the public safety immediately to eyes a patient come in is but on the other side is the public research, was a different data set for different, for a different use case, where as we've said, the anonymization.
Trying to keep this away from public research?
No, we're trying to make the data available for public research, but not necessarily in a.
I feel like I'm totally missing the point here. Who are we hiding this from? Well, I mean, I am not comfortable with this waiver because I think that it implies that there is. It implies that that we actually are going to be violating some, because the data is going to be out there, right? So who are we trying to not let see it in a cogent one-stop shop? Who is it? It's I heard competitors are going to go and look and research and going to find their competitors' client list. I mean,
So if I may.
is that what the argument is?
It's about anything that can be ascertained that would be proprietary once we release the data. So again, the data goes out. So from the public health and safety perspective, the research perspective, all of those things, the information is available. That's why I'm also concerned that we're off base here. The answer.
The information is not proprietary. It only, I guess, becomes proprietary if someone is using it for either an inappropriate competitive edge, and that's why we heard the argument of client lists. And I don't think we're releasing client lists. So anyway, can we, all right, go ahead.
So indirectly, we are, and that's the risk, is that because of the data has the lab and it comes from a client. And so while de-anonymized at the moment, people have attempted to try and match those up and to create a client list. So I, as a lab, if I'm a lab one of our labs. I know what my tests were. And so I can go through and figure out which ones of these are my tests, which now gives me a sample of what's not my test. And I can probably guess by looking at sizes who might be the competitors and then identify which customer is going to which competitor.
So in the alternative, what we've had is not open data, but we've had corrupted data, which then has had an impact on client lists because we have not as aggressively regulated this. So we don't have to look at client lists. What we have to see, and that's what we looked at. People looked at data that should have been made public to the legislature that we didn't allow the legislature to see. And so we had a shift in clients, a competitive disadvantage based on potentially inappropriate testing. So I'm more concerned, and this is again, it's a balancing. Are we more concerned about the competitive, intersection of individual licensees? I want to make sure that we're doing what we can, and I am more worried about liability. And frankly, we've had testing labs report on other testing labs because they are saying there is no way that I should be losing because I'm acting honestly, and I have a sense that someone else is not acting honestly. So anyway, I one more, and then I can take a vote because you either think that again, it's Lady Justice, you one or another, and either you think it's okay or you don't. Okay.
Again, this is, we're presenting you with this, and it's really, it's the board decisions, and that's what we're asking for. I do want to push back a little bit on the corrupted data comment, because it's not corrupt data. It's not identified. It's not the full data set. We follow standard research processes. So the data that's out there is in consistency with other data.
Say corrupted data. I'm referencing the
process.
The testing that we have seen by looking closely at data, that there are anomalies in terms of who's getting business, and and we have, at least in one case, we have demonstrated that possibly the reason one testing lab cornered 25% of the market, and we suspended them because we had problems with their testing. So anyway, I think that Commissioner Ryan and then Commissioner Bennett, and then I'd love to call a question.
I just have on the data dictionary. It's our document. Who wrote it? How old is it?
It was done by Marianne, Dr. Sarkis, with consultation with the research team. I believe it's about 2 years old, but it was posted in 2020 with the original data release.
So one of the bullet points says encourage responsible secondary use of the data for further public health advancements. So it says develop clear guidelines and data use agreements. So, when we when we go on a website of a cannabis licensee, what's the first thing they ask?
The age verification?
Yes. So is it possible, as opposed to waivers, have that data use agreement to access it? You have to hit that, we have it there, you have to hit yes to access it. And that indemnifies us having that data use agreement to access that de-anonymized data.
I'm going to defer to legal on that question. That is a standard within the research world of these data use agreements as to how you're using data. When we have met with the government, the federal, to share the data with different agencies, there's a data use agreement.
Why don't we have that?
Defined,
Got it?
so.
You got to agree to it.
How about this? How about we table it? We will table it.
Commissioner Bennett had a question.
Oh, I beg your pardon. I'm sorry.
Sure. I just wanted to ask a clarifying question to make sure that I understand really the need for the de-anonymized data. So it's clear, I think, to all of us that consumers have the COAs, and that's generally what a consumer would want. We as the commission have the lab information. So we as the regulators should be able to do our job, if we're doing our job, and see discrepancies or disparities between the labs. And even if the information is anonymized, researchers can still see lab A, lab B, lab C, and they could do research and draw comparisons. What is missing?
What is missing is how did we make a determination to suspend the license of Assured? Was that a tip from a competitor?
Started as a tip.
Yeah. So let's table this. Let's see if we can do what Commissioner Roy recommends.
A data use agreement
Data use.
to access it.
Okay. I'll talk with the legal and see if we can work on
Yeah.
a proposal
All
for
right.
it.
Okay, that might be a good compromise.
Yeah, I think that's a compromise.
I think that might be a good compromise. Okay, thank you. All right, we can move on. We are going to have a brief conversation about the executive session minutes release process. And then after that, we will be moving into executive session. And just for the 82 people who are watching remotely, it will be my intent that once we complete this conversation in public meeting regarding the release of minutes, we will be then going into executive session and we will not come back into public session. Okay. Executive Director.
Madam Chair, you're looking for me to do the
Well,
executive session process update?
All right, so we have a new secretary and it is, again, in the name of transparency and in the name of following the rules. We know that the commission had a number of several open meeting law violations and that there were minutes that were withheld, videos that have been withheld. We have had, there have been delays in approving executive session minutes that may or may not have been done in a timely fashion. So one of the questions, and I know that Commissioner Benedon is, obviously, probably we can't get any better expert on executive session minutes, and she had shared with me some of her thoughts about how we can improve the processes. We may or may not take a vote on something like this, but it really is having the conversation, and I think you've had a little bit of time to take a look at it, and I think you've seen some ways that we can improve. Thank you, Stephen, Paul, thank you. I think that you have some initial thoughts on how we might take a look at that and make sure that we are, following the Attorney General's directives to release executive session minutes, and that we have a process to make sure that we are approving. Because I don't think I've ever seen executive session minutes. So it's until last night. So yes, please, if you could,
Okay.
Thank you.
Great. So, and thank you for the opportunity to explain what I understand about our process. And I'm going to start by explaining kind of what our obligations are, because when it comes to executive session minutes, we have obligations under both the open meeting law and the public records law. So when it comes to executive session minutes, we have to keep and maintain minutes of all of the executive sessions. And we have to periodically review those executive sessions. And I think that's what we're really referring to today. We have to periodically review those executive session minutes to see if the initial purpose for which we entered executive session is ongoing or whether it has ended. And the Attorney General recommends that that be done no less than every 6 months. Our practice here is that it is done about every 4 months. And my understanding, I haven't been here 4 months, but my understanding is that it is done every 4 months. There's that review. If a set of executive session minutes is reviewed and it's determined that the purpose for.
Can you define the review?
Yeah, and that's,
Okay, yeah,
that's
that-
I don't want
that-
to go into
yeah,
more detail.
yeah.
Our practice, my understanding is that our legal team has done that review. And then they come to one of our meetings and make a recommendation, and they'll say, let's say I reviewed these 6 sets of executive session minutes. 3 of them, these are just examples. 3 of them relate to litigation that is still ongoing. And so I recommend that these continue to be withheld. 3 of them are related to matters that have been completed. And so these no longer need to be withheld.
Mhm.
Anything that is withheld needs to continue to be reviewed every time at that periodic review. what can be complicated or confusing is that if legal counsel says this set of executive session minutes no longer is being withheld under the open meeting law because the purpose, let's say it was to discuss a personnel matter and that matter has been fully and completely resolved, those are released, which means their characteristic is that they are released to the public. It doesn't mean they have to be posted online. We might choose to adopt that as a practice, but their characteristic is that they are released. They can.
Can you define released?
Release just means that their characteristic is that if somebody were to ask for them, they would get them.
Sorry, thank you.
Um,
A public
those-
records, they're subject to public records.
Now, but it doesn't mean that they are guaranteed to be made available in their entirety.
Mhm.
They can still be redacted either in whole or in part under any of the exemptions to the public records law or the attorney-client privilege. And so you could, in theory, have a set of executive session minutes where we discussed, let's say, a matter with legal counsel at length. And we say the matter is resolved. The open meeting law doesn't allow us to withhold the minutes. So they are public, but they are redacted in their entirety. If somebody asks for them, what they get is a set of minutes that says the date and time and who was present, and the whole thing is redacted. And we don't have to continue reviewing those because those redactions presumably are permanent. And so I think part of what some of the lack of clarity or perhaps disagreement is with minutes that have been reviewed and are no longer being withheld under the open meeting law, but are heavily redacted. And that may well be appropriate, but we may want to decide on a different approach.
Chair, Commissioner.
Through you, Chair. Benedum. So we're saying the matter is resolved, so they should be released, but they could be under an exemption or attorney-client privilege. They could either be redacted or continue to be withheld from the public. So my question is, the legal counsel may invoke privilege, but the board can vote to lift privilege, and therefore they would have to be correct. And we ultimately decide if there's attorney-client privilege.
And so that.
Client.
Exactly, yeah, if I may.
Oh, please,
Yeah.
thank you.
And so that brings us to what I think warrants a discussion and perhaps a proposed policy for further consideration, maybe at a meeting in February,
Yes,
which is, my understanding is that the practice has been that our legal team reviews the executive session minutes. So a staff member prepares them, somebody from the legal team reviews them and then makes a recommendation, but we as board members don't actually see the full executive session minutes when deciding whether to accept that recommendation, either to redact them in whole or in part, or to release or not release. And so,
But if I could just, and this is also, I mean, no, but if I, okay, but I just, all right, go ahead. I beg your pardon.
I'm sorry. Say that I think it would be appropriate for us to discuss as a board if we want the board to have more involvement. If we are comfortable saying we will accept the recommendation of the legal team without actually seeing the minutes, or if we feel as board members, it's our responsibility in order to comply with the open meeting law and public records law that we actually feel we need to see the executive session minutes to satisfy ourselves. I don't know that one approach is necessarily correct or incorrect, but I think that we have had a practice, but not necessarily an intentional policy as to how we handle that.
But this was a question that I had raised with you, and again, I don't know how you vote on executive, and do we vote? I don't, you know, I don't know if I ever remember voting, but how do we vote without having seen what's redacted, especially if the person redacting it wasn't in attendance, and we have to vote on the accuracy of the minutes.
Well,
And as you and I also talked about, the minutes for these public meetings are almost irrelevant in modern times right now because you can even go to the tape.
right, there's a video.
There's a video, so we don't need anyone's interpretation of what was said. You get to see it yourself at minute 1:45:15. So I think it's actually interesting that the technology hasn't caught up with the requirement for minutes. So anyway, Commissioner Wright, go ahead.
Thank you. This is so helpful. Thank you so much.
Yes, no.
And so I've requested in the past to go into executive session because I needed more context around the minutes sometimes they'll have the date, just say the date, and I can't remember. And then I was said, well, Commissioner, executive session, oh, Commissioner, Roy, but you take wonderful notes, you should know this, but that wasn't the right answer. So I'm wondering if commissioners, should they have the opportunity to see executive session minutes unredacted if we request? Do we have that right to see the minutes unredacted? Since we took part in it, can't we get them unredacted, the executive?
Please, thank you.
I think that really is a question of policy for us. I don't believe that, and I'm here as a commissioner now.
Yeah, I know.
Special expertise
But-
that we appreciate.
But I do not believe that either the open meeting law or the public records law addresses this issue insofar as them giving us any special access. Under the public records law, if somebody were to make a request for minutes, you don't consider the person's role or use of the documents. So, the chair of the board is treated just like any other person in the public who asks for something. And none of those laws specify that, for example, any sitting commissioner should have full and unredacted access to records. But it's reasonable for us to discuss if we want that to be the policy. And that's why I'm saying.
But how does one vote, or are we all responsible for taking personal notes? So how does one vote to adopt minutes?
But do those notes become, those are not your documents then, once you make notes, like?
Yeah, well, are the, so say, and she is a frighteningly good note taker. So are all of your notes public records, or her notes public records? And is that someone saying, okay, you take your own, I mean, when we're engaging in debate, I'm not able to take notes. So if someone from legal says, oh, you're a really good note taker, so you should know what happened. And you should know that what we've redacted, you should trust that what we've redacted is okay. And that's also, I think, part of the trust issue when there appears to be sometimes subjective redactions, not based in law. And that's where I think we need to have the ability, especially if we have to vote to accept them, and this may be part of the policy that we vote for. We need to know what we're voting.
I think we need a policy.
Yeah,
Right,
Yeah.
right. So I think that this is really something for us to decide. When it comes to executive session minutes, unlike open session minutes, we don't have to formally approve them. And somebody other than us as the board, for example, a member of the legal team, can do that periodic review of executive session minutes on our behalf. It doesn't have to even be done by us.
Mhm.
So I don't think that we as a commission have an established policy, although we may have a practice. And it seems to me that it would be appropriate for us to engage in a discussion about what we want that policy to be if we are not satisfied with how it's currently being done.
Commissioner Roy?
Not to add to your plate. Could you bring us a policy, like today I brought a suggested policy, like, say I brought a draft of what a receivership form could look like as a starting point?
Yeah, I'd be happy to do that for
Okay.
one of the February meetings.
And in your review, in terms of us releasing minutes, what is your observation in terms of us, releasing executive session minutes? Because, we've also seen, in some occasions, frankly, we've seen the Attorney General's office direct the commission to release minutes unredacted, but only with legal privilege. And I have sometimes questioned the legal privilege. And then I'm told I have to file a public records request and I have to go to court. I've literally been told that. So that is my frustration, in that I do think that as a policy, we should be making sure that we know what we're voting for, making sure that the record is accurately reflected. I think we should be able to see it redacted or with suggested redactions and have the opportunity to push back on legal to determine, because I have seen where, I don't see any legal authority. We're literally not given any legal authority for a redaction, yet things are redacted. So I would love to have you give us some advice on that. Commissioner Roy.
What would be helpful is when there's a recommendation to withhold the legal basis, why we're withholding. Because sometimes I push back, say, well, this matter was settled 2.5 years ago. Like, what is the legal basis? Like in writing, why you're with like, because I'm all for transparency. I think if a matter has been settled 2+ years ago, I don't understand the rationale to keep withholding. And so it's part of the recommendation. If there's a recommendation to withhold a legal basis, why to withhold? I
And
think
the
would be helpful.
embarrassment standard, I have not read in statute.
No.
And I have heard that used. It's embarrassing. Well, I'm embarrassing myself today, you know, and everyone's going to get to see it. They're going to get to watch it on a video and then they can make a decision, you know. So that is, we need to have much clearer guidelines. Because again, I have literally seen someone won't like that. And that has been the rationale for not redacting. And so I do think that we have to have nothing special, nothing, but if we're told by the Attorney General, which we have been in open meeting law violations, to release minutes unredacted, and then we hold on to minutes or we hold on to videos, and then we have redactions that have no legal basis, that's what I'm concerned about. Is it has to be the same across the board. And I think we lean towards more transparent rather than less transparent. And I think that we give the commissioners the opportunity to ensure that whatever we're voting as a set of minutes to accept, that we understand the legal thought process that went into redacting anything. So that would be, you know, my last. And Commissioner Stebbins, do you have any thoughts?
No, I appreciate, appreciate the fact that we have, you know, followed what, if I'm hearing you correctly, Commissioner Benedon, we've been following what we've been prescribed to do. However, there's some additional steps that we might have an opportunity to take it to use through, you know, a review of a new type of policy.
Right. So with that, thank you very much. And I will, we will be moving into executive session, but before we do that, because I was not necessarily clear about how we would do that, I will let people know that our next meeting date is the 27th, and that we will be entering into an executive session, and we will not be returning to public session after the executive session. So I believe I have made that clear. So anyway, for the record, the individuals participating in the executive session will be the 4 commissioners, Executive Director Travis Ahern, General Counsel Kato Chattopadhyay, Attorney Stephen Ludzinski. As a reminder, the commission will not reconvene in open session. So I seek a motion to enter a closed executive session under General Law, Chapter 30A, Section 21A3. Oh,
Do you want to mention, we'll probably have somebody from legal keeping, Avania?
oh, please, yes, and I didn't have Avanya, and add Avanya to that as well. All right, thank you. And so adding Avanya as a participant under General Law, Chapter 38, Section 21A3 to discuss strategy with respect to collective bargaining or litigation, because the open meeting may have a detrimental effect on the bargaining or litigating position of the public body. Commissioner Stebbins, do I have a motion to move to executive session and then adjourn there? Oh, I'm sorry.
Just to make sure that we're compliant, are we able to inform the public of what specific litigation bargaining matter, or can we say briefly why we can't?
To discuss litigation strategy and to discuss certain privileges that have been invoked regarding personnel issues and redaction of executive session minutes.
Okay, that's nice.
Does that
Litigation that we are, if you can.
it is not current litigation.
Okay, so litigation that we.
No, that's not true. Yes, current litigation. Yes, current litigation. Yes, yes, litigation.
That's suffice.
Does that suffice?
Is there a reason that we can't identify the specific?
It is a personnel matter. Okay.
We need a process on that too.
Yes. Yeah. Okay. All right. All right. So to discuss a strategy with respect to litigation or personnel issues, because the open meeting may have a detrimental effect on the bargaining or litigating position of the public body. So with that, I'll fix this. Again, do I have a motion to adjourn to executive session from Commissioner Benedon?
So moved.
Do I have a second? Commissioner Roy? Having been moved and seconded, I'll call the roll. Commissioner Benedon?
Aye.
Commissioner Roy?
Aye.
Commissioner Stebbins?
Aye.
Chair votes aye. We unanimously are going into executive session. Let's adjourn to the executive conference room at 4:15. Well, that's